Okay. We'll wait for everyone to get in, our attendees. Oh, okay. So the stream is on, I think. If someone can check YouTube, that would be great.
Yes, it's on YouTube.
It's on. Thank you, Tom. Welcome, everyone. Welcome to the weekly Doctors Against Genocide webinar. Thank you for joining us. We have a busy program as usual. We will hear from guest speakers, and we will also have our regular partners in Gaza, in Sudan, and in Congo. We have Dr. Swiyang. We have our Doctors Against Genocide members with us. We were on the Hill last week, so we will hear from Iman, Dania, and Dr. Padroni and many others about how it went. The situation in Gaza, unfortunately, continues to be very, very difficult. We keep hearing from our colleagues that with the winter season being colder than usual, and the tents being old and the infrastructure being completely destroyed, the living conditions are very, very difficult. Aid is not coming the way it should. Mobile homes that are the most important right now in the winter are not coming, and Israel continues to act with complete impunity and disregard to lives. There is massacres during weddings, in schools, on tents. It's not a ceasefire. It's everyone seizes, and Israel fires, unfortunately. We will hear from a group of medical students who are on the ground in Gaza. They are taking initiative to help each other. As usual, our colleagues in Gaza are one of the most resilient and most innovative people. And I think we can start hearing from Muhannad, since he's here with us. He is a medical student in Al-Azhar University. Muhannad?
Yes,
Can you
yes, I can hear
introduce
you.
yourself and tell us about your medical school, what happened to it? Tell us about your the fellow students who are with you. How are you managing? How are you learning? What are your plans?
Yes, sure. So first of all, I hope all of you are doing well and spending a very good time. This is me, Muhannad Ahmed Al-Falid, a fourth-year medical student from Al-Azhar University, and currently pursuing my education in Gaza. Today, inshallah, I'm going to share with you an update from about medical education from Gaza. First of all, as you all know, the destruction and the whole destruction of the university and many
Mohammed,
healthcare
if you don't mind, can you open your camera, please, or your connection is not great?
Okay, I will try.
That will be better if possible. If not,
Is it good? Is it good right now?
hold on, please. Yes, further.
Yes, okay. Yeah, thank you. So let me complete. So we all heard about the destruction which happened to healthcare facilities in Gaza. Me and my fellow students who are pursuing their education in a very hard circumstances decided to launch an initiative to help fellow students and all the medical students from both universities, Al-Azhar University and Islamic University in Gaza. So then it's registered as a non-profit organization in Canada, which is Mid for Gaza organization. The aim and the purpose of this organization is to help the medical students and support the medical education and empower the next generation of healthcare professionals in Gaza. and enabling them from pursuing their education in these very hard circumstances. So actually, our mission is to empower the students to become leaders in healthcare and community services, and building a global solidarity network that sustain medical education in Gaza. And we are providing a list of our programs during our organization. So the first one is which is financial support program, which we are providing financial assistance, monthly stipends for students, nearly from it's not a high number. It's $100 for each student, according to donations and support. And the second one, which is educational program, we support, we provide educational courses for medical students, research courses, and we conducted a medical terminology course for U1 students during the last period, and a relief program, which we provide relief services and aids to medical students in Gaza, which we provided two phones for two medical students. They were most needed for it. This is a general overview about the organization, about the services we provide. So, if you have any questions, I'm ready, I think.
How many students are benefiting from the program, Mohammed?
How many students? For the financial aid, the first stage we have provided 15 medical students from the final year, and 50, sorry, for 50 and 15 orphan medical students from both universities.
I see. So there is Al Azhar University, then there is Islamic University. Is your group mostly for Al Azhar, or you're trying to help students from both places?
We are mixed from Al Azhar University and Islamic University, but the most is from Al Azhar University. But we are mixed. We have members from Islamic University too.
Okay, okay. And
Yes.
you're based in Canada. If you wanna share with us in the chat, your website, or if there is any donation link for your organization, so we can share it with our members. If anyone can donate to help support the medical students in Gaza, that will be.
Yes, sure.
Yes. How's the situation now? What's going on now in Gaza? How's the situation now in Gaza, to your knowledge?
So it's actually um, not progressing a lot. The bombings is still sometimes even before, in the last hour they bombed, and we hear bombings almost every day. The healthcare facilities also need a lot of rebuilding. We are also Sweden and the so let me say يعني الجرحى من you can translate it الجرحى من آثار الحرب still موجودين يعني you can translate it to people there, and yes, that's it.
مهند الجرحى موجودين بالمستشفيات ولا ببيوتهم؟
في منهم موجودين بالمستشفيات، في منهم بيروحوا على بيوتهم وبيراجعوا بسبب انه عدم وجود الأسرة الكافية في المستشفيات، بسبب اللي هو الطاقة الاستيعابية للمستشفيات غير قادرة على استيعاب العدد الكبير من الجرحى والمصابين خلال الحرب يعني كانوا، وما زالوا لحتى الآن يعني. خلال المنخفضات الجوية الأخيرة كان في عنا بيوت بتنهدم على أصحابها، في عنا شهداء، في عنا إصابات من خلال هذه البيوت اللي بتطيح، اللي هي غير مؤهلة وغير صالحة للسكن.
Yeah, so the wounded in Gaza, the number of the wounded is extremely high, and their hospitals have no capacity to have them. So they sometimes come to the outpatient, or try to come to the hospital to get the outpatient treatment and then go back to their tents. or to their homes. Also, there has been a lot of injuries, and we have seen that a lot of injuries because some of the partially destroyed homes are collapsing on the people who are taking shelter in them because with the constant bombardment for 2 years, we know that 90% of the homes have been damaged, and people
Yes.
try to find a roof to take shelter underneath, and the structural integrity is destroyed.
Yeah, as you are all aware, also the Ministry of Health in Gaza issued an emergency declaration yesterday uh, for the critical lack of medical supplies and medications in Gaza, even for the most basic services, the emergency room, the primary care, the surgeries. Most of these sectors, across the sectors, there is a lack of more than 90% of the supplies and everything or everywhere in Gaza. They have zero stocks of more than 90% of basic medications. The Kuwaiti hospital, which is in Mawasi, Khan Yunis, Rafah, shut down its operating room yesterday for all types of surgeries, both emergency and elective, because of the lack of medications and anesthesia. The UNRWA also issued a dire warning yesterday. And I know we always focus on the children because the children are also a very vulnerable community, especially due to the cold, the hypothermia, the exposure. And they are, usually because of their body service and their body composition, they are more vulnerable to this. But they also raised the alarm about another segment of the population that unfortunately even we ourselves tend to forget, which is the elderly people. The elderly people actually are another very vulnerable community due to their, chronic illnesses, due to their failing health, and due to their dependence on proper care and medications and proper housing and proper protection from, the weather. So they issued that the elderly people are actually, many of them are dying due to preventable causes, just simple lack of their medications and medical care and proper housing. The other sector that they issued a warning on is the disabled individuals, persons who are living with disability due to the lack and the loss of their assistive devices, due to their incapacity to navigate through these harsh conditions, lack of proper houses. So we need to be aware of all of these. And unfortunately, as we always say, all these are man-made, engineered, suffering and catastrophes. There is aid, there is medication, there are supplies, there are winterized homes, there are shelters that are all sitting right there on the border, a few miles away from the people who need them. So please continue to raise the awareness. We actually went to DC last week, and our main ask was we just need the mobile homes. UNRWA and multiple international organizations said they have more than 200,000 mobile homes and winterized, tents that they can house almost 1.3 million people in Gaza, which can provide an immediate solution, at least temporary solution for the situation. And none of this is being allowed because Israel is preventing this as a weapon of war, using the weather, using the lack of supplies as a weapon of war to continue the killing and the extermination beyond what they could not achieve by bombs. So the genocide continues. We need to continue the pressure. No one should think that things are good and the situation is taken care of. So please, we need to continue the pressure. As we all know, there are other genocides also going on that are getting worse. We have our colleague, Dr. Al-Sadiq Al-Mahdi from he's a Sudanese American doctor from Sapa who's aware of the situation there. The situation in Sudan continues to escalate, to get worse. The areas of conflict and war and displacement is expanding by the day, despite the empty statements from multiple politicians all over the world that they're trying to do something, but nothing is happening. If anything, the situation is getting there. I don't know if Dr. Al-Siddiq is there with us. Dr. Muhammad, Dr. Al-Siddiq Al-Mahdi. Thank you for joining us. Thank you for joining us on the Hill, Al-Siddiq. And we want to hear from you about the situation in Sudan also, and how we as a collective, as healthcare workers, supporters, can help there too. تفضل دكتور صديق.
Assalamu alaikum, everyone. Can you all hear me?
Yes.
Yes, very clear.
Okay, great. I wonder if I can share my screen because I had some
Yeah, go ahead.
okay. Let's see. Okay. Can you all see?
Oh, yes, we see it.
Okay.
Go ahead.
Okay. Assalamu alaikum. So my name is Sadiq Abdurrahman Al-Mahdi. From Sudanese origin, but I grew up in the United States. I have been to Sudan multiple times. I lived there in middle school, and I have many family members who lived in Sudan before the war. Um, I'm part of the Sudanese American Physicians Association, so I was the president of the youth chapter, and now I serve on the board in the community service office, and that role entails raising, really coordinating like community efforts for Sudanese Americans in the United States, and then also being involved in medical missions. We have a program called the Emergency Medical Treatment Team, or Emergency Medical Teams, EMTs, which I'll speak about a little bit at the end. So I wanted to speak about Sudan today. I don't know what everyone's kind of baseline understanding of Sudan was, so I wanted to put together a little bit of a presentation to just kind of try to put things in perspective. This is by no means comprehensive, and it's there's a lot of information that's not in here. It's just something to kind of keep things on track. So Sudan is a genocide. I want to be very clear from the beginning. The war is in Sudan, but the genocide is in Darfur. So the genocide going on right now and the genocide from the beginning has always been in Darfur. And the reason I say that is because people of ethnic minorities are being systemically targeted in Darfur, which is Western Sudan. And it's been that way from the beginning. So what's happening in Sudan? So overall, unarmed civilians are being targeted. This has been the case the entire time. But like I said, the ethnic minorities are being targeted specifically in Sudan, or I should say in Darfur. So I'm just going to go through a little bit of background here. And so background is Darfur initially in 2003. So in 2003, there was a, so traditionally in the Sudanese history, unfortunately, ethnic minorities, non-Arab minorities who don't speak the Arabic language and are considered to be more African in ancestry, were targeted and not given the same rights as the Arab majority in Sudan. And this resulted in an uprising in Darfur, which was oppressed by Umar al-Bashir, who was the president of Sudan, or I should say the prime minister of Sudan for 30 years until his toppling. So he ended up systemically oppressing the population in Darfur that was fighting for their rights to self-determination. At that time, he used a group of warlords known as the Janjaweed, which eventually evolved into the RSF, who's committing many of the atrocities today. So that was back in the early 2000s, and that resulted in a lot of backlash from the Western world, and many people knew about that genocide, and then things kind of were swept under the rug, even though the atrocities never really stopped. And many foreign governments have been backing al-Bashir's work. in Darfur. So fast forward to 2019, al-Bashir was overthrown by a combination of a military coup with civilian protests, and in 2019 he fell with the help of General Abdel Fattah al-Burhan and Mohammed Hemeti Dagalo Hemeti of the RSF. So the RSF was the Janjaweed. Mohammed Hemeti was the leader of the RSF who rose through the ranks, and al-Burhan was the military general of the Sudanese Armed Forces, or SAF. 2021, there was a military coup between Burhan and Hemeti to overthrow the civilian government. And then 2023 is when the current war started, when tensions erupted because the armed forces, Burhan wanted to absorb the RSF into his military. So what's happening now? So now there's systemic targeting of ethnic minorities, which has been going on through the beginning, but it's more pronounced now. And the systemic targeting is specifically done by the RSF. I want to be clear that both sides are committing atrocities and neither side is good in this. But when it comes to the genocide, that is mainly being committed by the RSF. Boys are being targeted and executed, and women and girls are being raped. Children are of specific concern because they're being targeted as well. So that photo, so back in over a year ago now, El Jinan in West Darfur underwent several atrocities. Many people were murdered by the hands of the RSF, and children were executed as well. So that's when we started to see the genocidal aspect of this war start to take hold. And this has been over a year ago now, back in late 2023. But more recently is the fall of al-Fashir. So al-Fashir is a region in Darfur where there was an 18-month siege underway that involved the Sudanese armed forces attempting to take that area from the RSF. So the way the country is kind of split up right now is the Sudanese armed forces. So after 2023, when there was the breakout of fighting in Khartoum, eventually the Sudanese armed forces were able to push the RSF out of Khartoum towards the west. So now the RSF is occupying the western part of Sudan, which is where Darfur is. And you can see how this is a problem because they are the group who's systemically attacking the ethnic minorities, and the ethnic minorities are mainly in the west Darfur. The Sudanese armed forces still have Khartoum, but they have like a de facto capital of Sudan. I should have mentioned at the beginning, but Khartoum is the capital of Sudan, but now the current capital is Port Sudan. So the Sudanese armed forces has the east and Khartoum, and they were attempting to take the west, which was under siege by the RSF. But then after an 18-month-long siege, in early October or late October, I should say, is when al-Fashir unfortunately fell, and nearly 500,000 civilians were displaced at that time. Many atrocities occurred, and that's when the footage was released all over the internet of all the disgusting acts that were being committed by the RSF. That's also when Yale released their very consequential data of all the killing that had been going on, and that's when we saw the footage of or we can see the geospatial depiction of the blood from all the killing that was going on from space that got so many people's attention. So this was al-Fashir. This was the fall after an 18-month-long siege conducted primarily by the RSF, and civilians started to flee to Tawila. This has never stopped. It's still ongoing. More recently, in December 4th, the RSF has struck kindergarten, killing 64 children. And this was in South Kurtuban, which is another part of Western Sudan. So I just want to keep getting back to this, that the theme is that uh, is that the West is being specifically targeted, no matter if you're a child, a man, or a woman. So this is just a little bit of information. So Sudan's displacement crisis. So 11 million people have been displaced nationwide, and more than 25 million people face acute food insecurity and malnutrition. Over half the country's population is displaced. Many people needed to flee to either Egypt, South Sudan, or Chad, and the RSF has been also blocking people's ability to flee, so many people are trapped. On top of that, there's been blocking of information coming out, and also food and aid coming in. So the numbers that we're getting are probably not even accurate based on that information. So 5 million children suffer from acute malnutrition and severe hunger. So this is kind of everything that's been going on. I did want to talk a little bit about some personal stories. So me specifically as a Sudanese American, so like I said, a lot of my family was in Sudan. Alhamdulillah, nobody's left in Sudan now. Everyone was able to escape except for my cousin. My cousin was unfortunately murdered by the hands of the RSF in uh, in Khartoum. So he was murdered in the capital of Sudan, and his no. So my aunts were trying to get a hold of him, and nobody could get a hold of him. And eventually, we had somebody in Sudan who went to the house to check on him, and they found his body. The smell was so horrible that they knew that somebody had died, and they eventually found his body, and he had been killed. He wasn't able to communicate with anyone. The RSF mutilated his body, and this isn't something that's unique to me or my family. Everyone in Sudan has somebody who's been killed, and everyone in Sudan has a story of somebody who tried to escape the war and got trapped. My grandfather escaped the war. He's an elderly person who needed to flee across the country and then across the border to Egypt. And on top of that, there's people who have family in Darfur who's being currently attacked as well. So I wanted to touch, going back to this personal story. So this is the personal story of one of our Sudanese American physicians. So the heroes in all this are the physicians on the ground. We at SAPA, we work very closely with the doctors on the ground, the Sudanese Doctors Network. We also have our own doctors there, and we also work with UNICEF as well as other humanitarian organizations like Doctors Without Borders and HDF, Human Development Fund. So there are many doctors, unfortunately, of our staff who've lost their lives. This was a doctor, a 28-year-old doctor at that, who has a personal story of how he had ended up fleeing, or not fleeing, sorry, staying behind in El Fashir while his mother had to flee for safety because he was taking care of so many people there. And because there's such a limit in healthcare providers in the area, him leaving would have had such a detrimental effect on the community there that they wouldn't have had enough doctors to care for the people in El Fashir. So this is Dr. Mohammed Ibrahim. He has a story on Newsweek that I can link in the group chat, but he has a very striking personal account on everything that happened from his mother leaving and the decision he had to make on whether or not to leave, and it's really moving. So I wanted to ask, is this a civil war? Many people, so this war hasn't been covered until recently very well. It was covered at the beginning, but then there was a lack of coverage for the now 2.5 years that it's been going on. Like I said, it started in 2023, and then more recently we've started to get some coverage, but even that is starting to die out. But while we were getting coverage, it was always covered as a civil war. So is it a civil war? I think the answer to that is no. It is not a true civil war in the sense that the civilians are not involved, and the major players in the war are not Sudanese nationals. So the RSF, the Rapid Support Forces, this group has a very strong alliance with the UAE. They're supported financially by the UAE and militarily by the UAE, and every other country that's listed here also has been able to strengthen the RSF through the UAE. So the UAE's weaponry goes through these countries and is funneled to the RSF. And this is in exchange for gold, because Hemeti, the leader of the RSF, has a stronghold of all of the gold mines in Sudan. And then the Sudanese American or Armed Forces is also funded by other countries as well, and it's not as simple as Sudanese Armed Forces versus RSF. There's many key players involved here, but I want to make clear that the biggest alliance within this is the UAE to the RSF. This actually goes well beyond this current war. Back from the Bashir regime, the UAE had a very close relationship with funding the RSF and Hemeti, and this goes back in when the war in Yemen was in its infancy, and the UAE was involved with that. They were using Janjaweed at the time, now Rapid Support Forces. They were using them to fight in the war in Yemen, and that's how this alliance between the Rapid Support Forces and the UAE became so strong, and it's still holding it's still holding to this day. And the UAE is supporting the RSF. I unfortunately can't remember who said this, but there was a quote that somebody said that if it weren't for the UAE, this war wouldn't have even lasted as long as it has. It would have ended almost immediately if it weren't for the UAE's funding of the RSF. So I just wanted to highlight how strong of a relationship that is, and it's not a civil war. So I think this all warrants a call to action to help the people of Sudan with protection, humanitarian aid, highlighting what's going on, and then holding those involved accountable. I think speaking about it is one of the biggest things we can do, because unfortunately, this is just not a well-known genocide. It's like I said, it wasn't really covered in the 2.5 years that it's been going on. And I think one of the best things we can do is talk about it more, whether it's on your social media feed, whether it's speaking to people in real life about it, or whether it's like we did the other day. I was honored to go with the Doctors Against Genocide and to the Hill to lobby, and a lot of what we were doing was talking about Sudan. And that was actually some of the feedback that we got from some of the offices, was that they're not hearing from their constituents about Sudan. So I think that that's something we can really use to our advantage, is that there's room for improvement there, where we can start talking about Sudan more. We can start sharing what's going on. We can start calling for action and accountability amongst those involved. So the Sudanese American Physicians Association is my organization. I want to be clear, I'm not here speaking on behalf of the Sudanese American Physicians Association, but I am heavily involved with them. So you can go to our website and see what it is we do. We have many programs. We provide food, we provide aid, we work with doctors on the ground, and you can go to the website and donate at any time. This is a fund specifically for Al-Fashir, and this was our hope for Sudan, and fundraiser that has been going on since the beginning of the war. And then it's very easy to donate. You can donate any amount of money, and so you can put in your custom amount, and then your money will be put to good use with hunger relief and emergency responses. Another organization to keep an eye on is Decolonize Sudan. They have a lot of very helpful resources, including education on what's been going on in Sudan, different reports to follow on. And then this is the Yale Research Lab report that I was speaking about. And then they also have all these articles and videos and podcasts. One of these podcasts breaks it down really well. This Useful Idiots podcast that came out recently, I think it's a very good podcast to listen to understand what's going on. And they also talk about different books. Other organizations, like I said, mentioned the Human Development Fund, Doctors Without Borders, and UNICEF are also involved. I also, with Sudanese American physicians, we're actually doing an ongoing medical missions trip. I was humbled to actually go to Sudan back in early September. I went as part of a medical mission to Sudan. We went to a place called Gaza, which is East Sudan. There wasn't any war, there wasn't any violence going on there, but I did see firsthand the aftermath of the war because of the lack of a healthcare system at this point. People were at high risk for many things. There's a cholera outbreak. There was a yellow fever outbreak where people were dying at large and alarming numbers. There wasn't access to adequate healthcare. I was at a university hospital, the Gaza Teaching Hospital, which is a medical school, and even in that system, they didn't have the ability to provide adequate care for their patients. And the thing that was important about Gaza was it was actually a hub for many people who escaped from other parts of Sudan during the war. So people would come from other parts of Sudan to get their care there. I saw so many people while I was there, and the majority of them, I really wish this weren't the case, but the majority of people that I was seeing were children. I'm actually an internal medicine doctor, so I was actually surprised by this. We were seeing so many kids with epilepsy, and kids who did not have access to their anti-epileptics and ended up with severe complications from having seizures because they lost access to their medications during the war. They lost access to their providers during the war. And that was truly humbling for me that I had the opportunity to go there. The doctors on the ground were some of the best doctors I have ever worked with, and they were staying strong for their people. Everyone I talked to while I was there knew somebody that was in the hospital with yellow fever. In fact, one of the doctors on the ground who was kind of acting as our guide and the person kind of facilitating everything that was going on while we were there, he actually unfortunately had to leave in the middle of the trip or towards the end of the trip because his aunt was in the hospital with yellow fever, and unfortunately she ended up dying. So this is not, like I said, a lot of the things going on here, it's not escapable. You see this everywhere in Sudan. Everyone has somebody affected in some way. But going back to the medical missions, so this is the medical mission trip. We're in desperate need of people to go on these medical missions. We have a trip coming up to Al Fashir, inshallah. And if you're interested, you can definitely sign up, and you can reach out to me after this to learn more as well. I'll get you connected with the community service office where we can get you everything you need to know.
Thank you so much.
Yes.
I do have a question. The medical missions, are they able to get inside Al Fashir or only in the Tawila or some an area that's close to Al Fashir?
So I believe at this point, I think it's going to Tawila. I misspoke. I need to, I have to give you I have to look into exactly where we're going, but I know like the idea is to help the people from Al Fashir, and I think it's actually Tawila that we're going to. But the population that it would be to help is the population from Al Fashir. So that's the next medical mission trip, inshallah.
Inshallah.
Can you stop sharing so we can talk to you more, please, Dr. Sadiq?
Oh yes, yeah.
Unless you want to share more slides.
I think that was the majority of what I wanted to say. I just wanted to end with one last thing, is that there is actually a Sudanese foreign, like a Sudanese immigrant from Al Fashir specifically, who is at risk for deportation currently. and this is on the Decolonize Sudan website. His name's Sabir, and there's a call to action to prevent him from getting deported. He was apprehended by ICE, and that was something that I just wanted to make everyone aware of.
Yeah,
Okay,
these
so I can
are
stop sharing.
very important.
Yeah.
Very important ask. And actually, thank you, Dr. Sadiq. Actually, this is the first time, I have to admit, this is the first time I have better understanding of what's going on in Sudan. The presentation was very comprehensive, very objective. And unfortunately, the scale of the atrocity there is unconscionable. I have a question for you. I mean, since the latest escalation, the atrocities in fashion, there was a lot of public outcry out there, and we felt like the world is finally paying attention to what's happening, including here in the U.S. Was there any material intervention from these countries to stop this? Because of what I'm hearing on the news now is things continue to escalate and get worse. You're still sharing your screen. Can you please stop sharing so we can talk?
Oh,
Yeah.
yes.
Okay, perfect.
Uh,
So,
oh,
I mean, this latest kind of upsurge of, sharing of the atrocities that's happening there. I mean, we felt the State Department's talking about it, the United States talking about it, the whole world's talking about it. Did any one of these countries do anything, tangible to ease the suffering? Is there any interventions there? Any pressure on the UAE? What's happening?
Unfortunately, to my understanding, there's no tangible pressure at all. I don't even think the RSF has labeled as a terrorist organization, and the UAE, the US hasn't, at least in public, hasn't really pressured the UAE at all to ease its funding of this war. Um, I don't know about behind closed doors. There was, I'm sure everyone saw, but the president or the king of or prince of Saudi Arabia, MBS, he had a call to President Trump to look into Sudan and um, try to help the people there, but nothing tangible really came of that. So unfortunately, it's still kind of just paying lip service to everything that's going on there.
So I agree with you. This means that we need to speak up more. We need to bring the plight of the our people in Sudan more in every way we can, everywhere we can. Thank you for joining us, Dr. Al Siddiq. Please come and join us every week. Give us more updates. We need the voice of those victims in Sudan be heard all the time. We, as an organization tasked to stop or advocate against atrocities, against encroachments on life, everywhere in the world, whether it's in Sudan, and Congo, and Palestine, Rohingya. We want to keep speaking. We need to unite voices. We need to amplify our voices. What you shared today is very profound, very comprehensive, and honestly, for the first time, I kind of have a better understanding of what's going and what to ask, because many times, even when we went to the hell, we didn't to hell, not to the hell. Okay, to hell in DC. I always mix them up. Maybe it's the right mix up. Anyway, so every time we go, we were confused. Who's right, who's wrong, what to do, what to ask. But you made it very clear. Please share all these links. Please support the doctors, Sudanese doctors, SAPA, Sudanese American Physician Association. They have been doing great work, and inshallah, us and Dr. Sadiq, we're gonna have more collaboration and work together. And please, anyone who can make a mission, please go there. And I have a few more questions for you, Dr. Al Mahdi, before you go. Dr. Swiyang, please.
Yeah, maybe this is not an appropriate question. At one stage, you see, when there's all this talk about deporting people from Gaza out of Gaza, one proposal is that they go to South Sudan. I want to know why, because the situation in Sudan is bad enough without having take 1 million people from Gaza there. Can you explain to me what's the logic behind that?
Sure. Thank you for your question.
I'm sorry to ask a question. Yeah.
Um, So South Sudan is actually an entirely different country from Sudan at this point. So South Sudan used to be part of Sudan, and then back in during the Obama administration, because there was so much violence going on between the South and North Sudan, the country was actually split into two. So everything I talked about right now is in Sudan proper, and then South Sudan is a completely separate country. I will say though, South Sudan also has its own war going on, its own atrocities. So I think it's horrible that they want to send people there because there's ongoing killing going on there as well. Unfortunately, uh, there was the irony is like splitting the two countries into two just resulted in two wars, two separate genocides, if you want to call it that, because South Sudan is also an ethnically based war as well because of the different tribes. And that war, to my understanding, is also ongoing. I haven't been keeping up with it as much because I'm more focused on Sudan, but I remember hearing that, and I didn't understand why in the life of me they would want to send people from one war zone to another war zone.
Yeah, I have some insight about this, Dr. Swiyang. So South
Yeah.
Sudan, it was carved out of Sudan by the support and pressure of Israel and the United States. It was not supposed to be divided from Sudan. And the plan now, Israel and the UAE are the major supporters of the RSF, the Rapid, support forces, and their plan actually is to divide Sudan into yet another two countries, the West Sudan and the East Sudan. And part of the bargaining they are giving to RSF that we are supporting you with all these weapons and support. In return, you want to take the people from Gaza and put them in East Sudan. So, I mean, it's a lot. I mean, these are human evils, devils are playing into these massacres, and they're playing with us as, I mean, they're herd, and they don't care about human dignity. They don't care about human rights. They don't care about self-determination and about the right of every people to stay where they are and live in peace. So I think part of the support why the situation in Sudan actually escalated lately is because Israel, the UAE, and some of their supporters are pushing for this and are trying to find a place or pressure that part of the Sudan to accept Palestinian not refugees, I mean, people who are expelled from Palestine. Again, as if there is not enough on our hands, we have another situation going on in Congo, and we have our colleagues from Congo. We have Khadija, who's going to give us some updates, although I think Khadija updates might be a little bit more easier or lighter on the heart because she and her team have been doing a great job helping the victims there. So Khadija, it's all yours. Please share with us the latest updates on your work. Then after that, I mean, please forgive us.
Dr. Zarni is with us too.
Yes, after that we'll go to Dr. Zarni, then we'll go back to Gaza. We have so much going on today, too many guests, but please be patient with us because it's all important information. And again, all these genocide atrocities are happening in front of our eyes with the complicity and direct involvement from our governments and politicians. تفضل Khadija.
Salam, everyone. Hi, my name is Khadija. Thank you for the opportunity. Thank you for the space and the community with DAG. It's been an incredible past few months. The situation in the eastern part of the Democratic Republic of Congo has deteriorated in the last, it keeps deteriorating over the 30 years that this conflict has been going on. Of course, women and children are the most vulnerable, but the war has been fought on women's bodies, obviously as a way to break the fabric of the community so that people flee and so that America and her allies descend on the natural resources that are supposed to be benefiting the people of Congo, but so far that has not happened. On December 4th, the president of DRC and the president of Rwanda is the country that is being used by Western powers to invade Congo, to fund a proxy war there, to fund armed rebellions there, to displace millions of people, and to exacerbate an already horrible humanitarian crisis, an already deplorable public health crisis. So the two presidents were in Washington, and a peace agreement was signed under the auspices of the United States. President Trump was very boastful about the fact that he has brought peace to this region that has suffered a lot of insecurity and instability. But of course, on the morning of that peace agreement day, and yet another territory was captured by the aggressors, and 200,000 Congolese civilians were forced into a neighboring country. These are people who are fleeing on foot with everything that they can carry on their heads. The doctor from Sudan, Al-Mahdi, who just spoke, very inspired by his presentation. Next time I will do my best to bring forth such a presentation so that we can understand the scope and the seriousness of this situation in Congo, the humanitarian crisis in Congo. So these are hundreds of thousands of people who are fleeing with everything that they have on their heads. Children are walking for days. This is a region that has so many lakes, so many rivers, a lot of forest and thicket, just very densely forested areas. So you can imagine the feet of these people. They have been forced to walk for all in this terrain. Water that has been is infested by snakes and hippos. They have to cross in small boats. Just a terrible way to live. It's purely animalistic, and it should not be happening this way. So that's the situation. No peace is in sight yet. If Claude is here, he can go more into the political aspect of it. He has spoken about it before, and it is it's in the mainstream media now, just because it's become so bad. Us on the ground as a grassroots organization, our name is Let's Act Together for Congo. You can find us on all social media platforms. We have been in collaboration with DAG for a few months now. And DAG was kind enough to offer us a grant that has been going into doing such incredible work on the ground for these.
Khadija, is it okay if I share some photos while you're...
Absolutely, yes, that would be great. Thank you.
Keep talking, Khadija.
So with the help of DAG's grant, we have been able to do a lot of good grassroots organizations, especially our community mobile clinics into the rural communities of Eastern Congo, where people have not been able to see a healthcare professional maybe all their lives. And now they are seeing our volunteer team of a few nurses, a doctor, and a public health professional who is Philippe. He's part of a team. And we've been going in there. We have taken a physical therapist who has attended to, cared for the elderly, for the children. You know, this matter of running around all the time, not having anywhere to stay for a long time, it wears on their body. So just being attended to in that way, providing nutritional supplements to children who are suffering malnutrition. We've been able to tend to the wounds of the children which have festered on their feet because of running for so long. Just so much good has been able to be done for women. We have provided sanitary care supplies. We have been able to give hygiene care supplies, toothbrushes, and toothpaste, a little bit of water to these communities, just something to help them keep going, something to remind them that they are human, and to also remind them that they are people of the global majority who are with them, who are standing with them, that they have not been forgotten by our brothers and sisters who are in Gaza, who are going through their own kind of hell, a real hell and atrocities. But we are together, and we're standing in solidarity with humanity, and our brothers in Sudan. Sudan and Congo are not far away from each other. So it's been really beautiful. It's been really, really beautiful. And that's the silver lining out of all of this that has been going on in Congo. I was in the region earlier this year I was in the region, and the kind of lack and poverty that you see here, which in a country that is the most resource-rich country in the world, and you see that this is the epitome of injustice and the kind of world that we live in. I got to see that firsthand. Nothing could have prepared me for that. But so grateful for this community and for the work of DAG that has helped us to give back to our communities in this way, in this direct way.
Thank you, Khadija. Thank you, Khadija. I mean, the pictures of the children, I mean, the children, all the children are ours, wherever they are, in Congo, in Sudan, in Palestine, in Gaza. And anyone who cannot feel compassion for the children, for their plight, for the situation they're there, has to check their humanity. It's just heartbreaking to see all this suffering on these innocent civilians that is happening needlessly, or just for the profit of the war machine, for those who are exploiting the resources, whether it's gold in Sudan or in Congo. What's the mostly titanium or
coltan? It's called coltan.
coltan.
Coltan is found in each and every mobile device, each and every electrical vehicle, each and every laptop computer. It's powering the AI and tech industry. Yeah, coltan, very important, and the people are suffering for it.
Yeah, so these human vultures, just for making more profit, we're talking about billions and billions of dollars. So Musk can make, $1 trillion wealth. They don't care about exploiting and destroying the lives of generations of people all over the world. This cannot be acceptable. We should not stay silent on this. Please speak up. Khadija and Dr. Sadiq, please share the links, donation links, information links, how we can support, our communities in Sudan and Congo, and of course in Palestine. We have, mashallah, we have our strong guests from Gaza. They're all available. But before we go back to Gaza, we want to hear from Dr. Zarni. Dr. Zarni last week, unfortunately, he did not get an opportunity to speak, but Dr. Zarni is a known genocide scholar. He mostly worked with the another genocide in Congo. Dr. Zarni was introduced to us by our beloved and famous Dr. John Rower from DC. So I'm going to leave it up to you, John, and Dr. Zarni, introduce each other, and we want to hear back from you. Then we'll go back to Gaza, please. John, you are muted, John. John, are you there? Do you hear me?
Yeah. Okay. Yeah. Sorry, I'm driving in a car through the mountains, so I may lose
you are? What's your story with Dr. Zarni? What were you doing?
So
what's happening?
Dr. Zarni
Should be causing trouble wherever you go.
Okay. Yes. So Dr. Zarni and I were on a trip to the West Bank in Israel, and went up to the border of Gaza, and watched the lack of trucks going in. We watched the military go in. We watched the smoke and bombs go up on the border of Gaza. The only mistake we made was not trying to walk in at the time. But Maung Zarni is a genocide scholar from Burma, who is one of the world's leading experts on genocides of all types. He's suffered greatly from the sickness of genocide before any of us, from his own people, things going on with the Rohingya in Burma, and he now devotes his life. And if you get on his mailing list, you'll see how prolific a writer he is about all this. So he's one of the world's great human beings, and I'm happy to introduce my friend Maung Zarni.
Thank you so much to all the DAG leaders, and also dear brother Dr. John Rower. And I also want to commend all the members of the DAG to convene this weekly webinar. It gives me a sense of hope that there's a community of human beings around the world, importantly healthcare professionals who pay attention to this issue. And also I am very happy to hear that the DAG's concern goes beyond a single issue of Palestinian suffering, which is the litmus test to all of us who are concerned about and angry about the continuation of the Anglo-American and European-led imperialism. And I want to name the names because it's important to know, what we are confronted with. And finally, I want to express my great admiration to my neighbor, the Malaysian Singaporean doctor, the renowned Dr. Sri Ong. She has been a role model and a source of inspiration for many of us for taking up the causes that every human community should concern themselves with. Last week, unfortunately, I had to leave because I had another meeting after having, followed the DAG proceedings for 2 hours. I learned a lot, and also today the presentation on Sudan. It was really my crash course. As a student of genocide, I cannot say that I'm concerned about the Palestinian genocide and no other genocide, or my own country's genocide against Rohingya, because genocides by definition, it's really an affront to every human that has conscience and empathy. You don't have to be a doctor or a PhD or genocide scholar. You can be a vegetable seller or a janitor on the street. But this concerns every one of us, because this is really an affront to all of us. An assault on a human community, a population, is assault on all of us, whoever is doing it, irrespective of race, nationality, faith, or ethnicity, or geographic origin. I mean, that is essentially the spirit and the essence of international law, known as the Convention on the Prevention and Punishment of the Crime of Genocide. The last Sunday, I listened to this very well-informed and scholarly presentation by a Spanish legal scholar and also vice president of the International Association of Genocide Association, which is the largest body of genocide scholars. There's also another organization that is parallel but smaller to that organization. But I want to move away from the understanding genocide from a rather legal and technical perspective of genocide, as is spelled out in the Genocide Convention, 5 the acts of genocide, genocidal acts, whether there is a single intent to commit genocide, because that's the International Court of Justice, a high bar, I should say, very right-wing and conservative reading of the Genocide Convention. The intent has to be proved. That if there are any other intent than the intent to destroy a demographic category or population in whole or in part, cannot be considered genocide. That has been the past rulings of genocide, and I find both the legal definition of genocide and the jurisprudence, that is like a case law that has been generated by the International Court of Justice and other UN judicial body, very, very narrow, intellectually impoverished. And I think that the Genocide Convention itself was not really celebrated by the Polish Jewish legal scholar who coined the term genocide, Raphael Lemkin. He did not celebrate the Genocide Convention coming into effect because he felt it was watered down. It was a political compromise among the victorious Allied powers, that had their own skeletons in their closet. So I want to move away from the legal definition and go into two things. One is basically a long history of the failure of international law to protect the people of color around the world, and the other one is the more like the sociological perspective that confront the international system of states that have a very, very long, I'm talking about like at least 500 plus years tradition of destroying populations for the sake of land and resources. And that, there is a single linear, uninterrupted thread between what happened to the so-called peoples, in the New World, Latin America, the Caribbeans, the Anglo-Saxon America, North America, basically Canada, US, and also Australia and parts of Africa and New Zealand. There are two types of colonialism have established this, dishonorable and mass murderous tradition of destroying populations, either in whole or in part, erasing history, erasing the memories, erasing names, and names of cities, names of tribes, names of kingdoms, all for the sake of what one of the DAG leaders talk about, for the sake of profit. And that has not changed. That has not absolutely changed at all. And I think unless we have the big picture, the French historian who invented this school, the Annales School, looking at history not as episodic but thematic, the rise of cities, the rise of commerce, the rise of Mediterranean trade, the rise of Southeast Asia as an entity over a century. He called it, his name is Fanam Brudal, and he called it longue durée. Things can be understood only if you take a long view of history, and that long view of history is so it's not missing, but it is present among those of us on the streets and the protesting. If you go to London for a protest, you will see this critical historical consciousness in placards, holding and chants and songs and speeches. People make the connection that this is a continuation of white supremacist, imperialist, a European offshoots, collective genocide, right? I mean, I know there are a lot of adjectives I just that throw in there, but they are there. And what we are seeing is not that different from slave raids of African nations to turn humans into commodities and future laborers, generations. Sexual violence on the slave ships, sexual violence on the plantations once they have been institutionalized in Brazil, the Caribbeans, the North America. So nothing has, over the last 500 plus years, essentially changed. There is an ascendance of white supremacist imperialism. There are two parts to this. One is the racial element. That racial element is connected to the organized religion, not like the Christianity as Jesus would have embodied, that the love thy neighbor. That's not the Christianity that is used as the justifying ideology to destroy populations. That ideology involves creating hierarchy of human lives and cultures and civilization, whose lives are worth, whose lives are at the top of this hierarchy. Well, obviously, the Christians and the white Europeans, they arrogate to themselves at the top of this the hierarchy of human races. That's why we hear BLM, Black Lives Matters, and then after the October 7th resistance uprisings, we hear Palestinian Lives Matter, and the same. It also applies to women as well. That's why you have the Me Too movement, right? And this all of this is coming from this ideological fountain of white supremacists, usually white male domination in every aspect of human life. Yeah, and that is reflected in different state policies, reflected in policies of the international state system we call the United Nations, right? And so I think like what needs to be understood is that law in the face of genocides committed by directly or indirectly as collaborators or complicit states, as we see most in most black and white fashion in Palestine and Gaza. We just focused on Gaza, but the rest of the Palestine is also subject to what I would call slow semi-genocidal process that can be sped up at any time. In the settlers from America, USA, Canada, Australia, from the different Zionist Jewish diaspora, 700 to 800,000 settlers. And in the old city of Hebron, the young settlers that with their babies and the buggies, they will go to the tomb of the patriarch, part synagogue and part the masjid, with American supplied M16 sub-automatic or semi-automatic rifles, going to religious service on a daily or weekly basis, right? So out of the 700,000, about 200 to 300,000 have been issued automatic machine guns. So in the West Bank, we are looking at some kind of Rwanda scenario down the road if the state of Israel decided to hit the acceleration for ethnic cleansing in the West Bank area. It's been happening as well. And so I think what we need to understand in the face of these state powers that have been used or that have been in symbiosis with, mother European and North American colonial powers such as the United States, UK, Germany, France, all across the world. The international law has remained impotent. Yeah, and I mean, the impotent is a medical terminology, and then the international law is not the panacea. And so I heard, the Congolese sister, the Dr. Hadija spoke about, the human connections. I think we are living through a radically transformational period in history that we haven't seen since the end of since the Second World War. Yeah, where the world is changing so fundamentally, and in a way, this process is so painful if you are Rohingya in my country, or if you are ethnic minorities in these places where their ancestral lands are so rich in natural resources like rare earth minerals, the coltan, the gas and oil, and all of that, and all even just simply like fertile soil, and happen to be on the strategic route for the Western powers, and now like we also have the other BRICS power, BRICS, Brazil, Russia, India, China, South Africa. They are all, we look to them to provide a different type of moral vision and leadership, but they're also like subscribe to the same global capitalist, economic model that is based on resource extraction, land alienation, like a market expansion, they're treating humans nothing but as laborers or consumers. There's no room for citizenship, no room for humanity in that capitalist model. So I just want to say emphatically, we really need to have a big picture. The big picture is that we are subjected to this type of mass murderers, mass exploitative political and economic system. And it doesn't matter at this point what colors of the skin, because your speech will be taken away if you speak out in solidarity with Palestinians or Sudanese or Congolese or Rohingya. Yeah. And then finally, let me just mention the two legal cases in 1 minute. There are two cases before the International Court of Justice that, with respect to Rohingya genocide. It's called Gambia versus the state of Myanmar. That was filed when Aung San Suu Kyi was the de facto state of head of state. Now she's in jail, and she was also complicit in the genocide, despite the fact that she is a Nobel Peace Laureate, right? And so 2025, the Nobel Peace Prize winner is no different from the Nobel Peace Prize winner from my own country. They're, either warmonger or militant and nationalistic. And that the other one is the genocide case that South Africa filed with the International Court of Justice. And both cases are in what is known in legal terminology is merit phase, meaning like a presentation of evidence and counter evidence before the 15 or 17 members of the International Court of Justice judges. And not whatever happens, I think the one thing is certain: the on-the-ground reality for Palestinian or Rohingya is not going to be affected by the International Court of Rulings, the Court of Justice ruling, because it is not the law that changes people's life. We use anything we have, like a toothpick, like a knife, whatever you have, pen, speak out. But law is just one instrument, many in the arsenal for people like us who don't hold state offices but who have a deep humanity, that we can connect with and offer solidarity and concrete help. And so just my last point is, law is not the savior. Law will not end genocides. It's only the people will end. The people who can mobilize powers of the state. Mind you, international law was created by imperialist states when they won different wars. International law is used to pay lip service to the well-being and protection of the people. And the states that are involved in these Israel and Myanmar genocide cases, they take radically different positions on two genocides. In the case of Myanmar's Rohingya genocide, UK, US, France, Germany, Netherlands, these states present themselves as good guys. They speak for the victim. They throw crumbs at the the Rohingya genocide survivors, 1 million in Bangladesh. I'm thankful that the Rohingyas have something to eat, because these states have given them the millions in humanitarian aid. But I'm also very, very angry and disgusted that these are the very same state that supply Israel with weapons, finance, diplomatic protection, propaganda cover, and you name it. And finally, they are prepared to destroy the democratic institutions in their own countries, US, UK, Germany, so that they can crack down on those who oppose Israel's U.S. joint genocide in Gaza and continue occupation of the rest of Palestine. So I'll stop there. My message is, don't allow yourself to be swayed by the lawyers and the legal discourses. That is not going to stop the genocides anywhere. It has to be global, solidified people's movement. Yeah? And so we cannot be lulled into believing that the institutions, the instrument of imperialist law will be our Messiah. Thank you. I'll stop here.
Yes, thank you, Dr. Zarni. That was profound, very informative, and thank you for warning us that the international law, the same law that was designed by the imperialists and by the aggressors to fit their interest at that time, is not going to save us. It seems that the law is only applied and enforced against the weak, not against the the strong here. And even those who put in place these international laws 70, 80 years ago, because it served their interests, now they are going against them now because their expansionist interest and their power has advanced so much now that the law is in their way. So they are working on dismantling these international laws, universal laws, international courts, because they don't need them. They have the power, they have the tools, they have the domination, and they would rather go to the law of the jungle now because that serves their interests better. And as you said, maybe at one point it was maybe the imperialists, the interests, the elites, the ruling class, the wealthy, the white supremacy. But at this point, it seems that the whole world, all our future, is at the mercy of a handful of people, so powerful people that are controlling everything. And these are, the ruling class with the United States or in the West, mostly, along with their Jewish supremacists. And we are all, as human beings, even the people in the West, even the white people in the West, are at their mercy. And anyone who tries to challenge this or speak up for humanity and for justice, for fairness, will endure their wrath. And as you said, they are willing to even, to even go against their democratic rules and constitutions to silence anyone who speaks up against them. Dr. Zarni, this is very informative. Thank you for joining us. We want to hear more from you because that is a heavy material. We're not going to digest all of this in maybe in one session. So please welcome to be our guest whenever you can. Every Sunday we are here. And again, this is not just, as you said, it's not just about doctors, healthcare workers. This is all about our all humanity, shared humanity as a human being. And I think we, the people, the majority, 99% of the people in the world, do care for justice, do care for equality. It's just when we are silent, we are already and voluntarily giving the power to these very few people who are committing and benefiting from these atrocities. And if we, the people, unite and continue to speak up, we need to change this, and we need to reclaim our humanity and our planet. So thank you, Dr. Zarni. Anyone from the panelists have any questions for Dr. Zarni now? I know we have many speakers. We want to go back to our colleagues from Gaza. Any questions at this point?
Yeah,
Yes, go ahead, Dr. Sui.
I just want to thank Dr. Zami. I just want to tell him within the last 6 months, the UK government has arrested 2,500 UK citizens, all remanded on bail, and 31 of them remanded in custody. That means detention without trial. So you're completely right. In this way, it's colorblind. You speak up for Gaza, you criticize the Israeli government, the British government will get you. So the law is not the only protection we have. We have to create something which is more powerful than that. Thank you very much for your wonderful advice.
Can I just say like one thing very, very quickly,
Sure.
Doctor, following up on Dr. Sri Young's comment. We have at the moment hunger strikers in UK, the Palestine Action and others who have been like charged with counterterrorism law, and they're in their thing like day 40s, and some of them are extremely weak, and the Justice Secretary David Lammy, I call him David Lammy, um, outrightly lied that he knew anything about the hunger strikers. And so if you have like friends and families in the UK, please ask them to write to Justice Secretary David Lammy, and the Prime Minister, the Zionist, the pseudo Labor Prime Minister, the Keir Starmer. And it's happening on their under their watch, and they should be held accountable for putting these like non-violent the genocide opponents at grave risk. And some of them, many of them are in their 20s. They're risking their lives.
They know because we have been demonstrating in front of his office at Downing Street. We have been protesting outside the individual prison, but we just have to keep on. We mustn't let them die. It's our duty to let them live. We will fight the system.
I mean, it seems Britain has a long history of people dying from hunger strikers. That happened during the, the situation with Ireland, and
Yes.
as Dr. Zarni and Eng mentioned, at least 3 of the hunger strikers is on their day 47, 48. They're in critical condition.
Yeah.
A couple of them were moved to the hospital, and they need all the support from us, all the, all our voices to pressure these so-called democratic countries to at least, their demand is just meet with Mr. Lamy, or at least hear them, listen to them. They did not commit any crime. The only crime they committed is they spoke against a genocide of other human beings, and they spoke for justice. They are not terrorists. They did not call for terrorism. The only terrorist here is the state of Israel and its supporters, including the UK government, the United States government, and the state of UAE that's supporting another genocide in Sudan. And all of these aggressors are also the ones who are benefiting from the genocide in Congo and other genocides. So it's really, really saddening to see that people who are speaking up for justice with words, with slogans, are being punished as the ones who are causing, threat to communities, while the people who are deploying the weapons of mass destruction themselves are being, projected as the victims here. This is the sad situation of the world, the global affairs that we're living in. That's why we need all our voices. Thank you, Dr. Zarni, for joining us, Dr. Sui. We need to unite, we need to mobilize, we need to bring everyone to speak the truth, and we, the people, need to reclaim our power, not against any people, not against any human beings, but for justice for all, for humanity for all, peace for all. And I think there is enough in this world for all of us to live happy in peace together without any divisions, without any racism, without any injustice. And I don't think there is any justification in the world for any single human being to have a wealth of $1 trillion here, $1 trillion there, while billions of people and children are dying from hunger. things can be done better for sure. We need our voices. I have to move on to our colleagues from Gaza because they have been waiting and their internet connection is not great. We have Abu Hamza. Abu Hamza, are you still there? Abu Hamza is one of the great, healthcare workers, paramedics. He's the head of paramedics in North Gaza. He's been on the front all the time, trying to rescue the children, the victims from these, genocidal attacks that Israel continued to commit. He did not give up any single minute in the last 2+ years. He lost his son, Shahid, who was also a paramedic, along with two other friends trying to rescue a family that was attacked in Gaza. He continued to do everything to provide despite all the difficulties. He managed actually to rebuild a small medical point in North Gaza, in the Jabalia area, where there is a complete lack of healthcare services there. And he's, as all the people of Gaza are, very impressive people. They don't give up. They keep trying. They defend their right to life, their right to exist, their right to rebuild, their right to their land, and they refuse through action all these systems of injustice. Abu Hamza, are you there? I'm afraid we lost Abu Hamza now. Haram, he's been waiting for a long time. Abu Hamza, are you there? Maybe he's trying to connect usually. Abu Hamza. Sorry. I'll give him 1 minute. Sometimes he tries to connect. I hope he did not lose the connection. Oh, he's here. Abu Hamza, are you there? Abu Hamza, we're waiting for you. He is there under my name. Rama, can you please change his name? I gave him my link
Yes.
because that is the only way he can connect. Abu Hamza, are you there? Lakh Faris. Yeah, I think his connection is weak. He had a better connection earlier. Hello?
He has his name Nidal.
Yeah, Nidal.
دكتور السلام عليكم.
Alaikum salam. Yes, put his name, please. That's he shared
Yeah.
my connection. أهلا أبو حمزة، تفضل.
حياك الله دكتور، نعتذر عن الخلل، احنا قطعنا مسافة عشان النت يكون قوي معكم.
Okay.
يا
Sabrina,
أهلا يا أهلا.
تفضل. We're ready for you, Abu Hamza. Share with us, please, what you need to share.
حياكم الله.
Yeah. Again, he have problem with connection. I think he lost it, but let's be patient. Give him another minute, please, because he has a lot to share about what's happening there. Abu Hamza, are you back?
معلش يا دكتور، معلش موضوع النت، مع انه رحنا لما
اوكي، شكله ظبط هلا. انميوت يا ابو حمزه. شكله ظبط هلا. تفضل.
معلش بعتذر
لا ولا يهمك. اوكي.
بعتذر عن الخلل. اول حاجة يعني بقدم تحياتي لك دكتور نضال وللفريق معك دكتور أشرف وإياد العماوي وجميع الضيوف من جميع العالم، حياكم الله. طبعا دكتور نضال، حنبدأ إن شاء الله بالتوضيح ما حصل من مأساة لأبناء شعبنا واستمرار الإبادة الجماعية. يعني لم تتوقف صراحة إطلاق النار كما يعني تم الإعلان عنه للأسف الشديد. قبل أول أمس تم الخروج لاستهداف عائلة في مدرسة إيواء شرق مدينة غزة، وشاهد العالم هذه المشاهد الصعبة والقاسية لأشلاء الأطفال والنساء. وهذه العائلة كانت يعني عائدة من فرح زفاف لأحد أبنائها، هي عائلة النذر وعائلة البطش شرق مدينة غزة. الاحتلال الإسرائيلي لا زال صراحة يستمر بإطلاق النار والاستهدافات المتكررة لأبناء شعبنا الفلسطيني، وبشكل يومي هناك شهداء أيضا في منطقة الشجاعية، اليوم شهيدين في منطقة الشجاعية. ومركبات الإسعاف التابعة للخدمات الطبية شمال قطاع غزة بشكل يومي يتم نقل المصابين على إثر إطلاق النار من قبل القناصة، وأيضا من قبل طائرات الكواد كابتر يتم إلقاء القنابل بشكل يومي، وهذه تعد خروقات لوقف إطلاق النار. لذلك نحن كطواقم
خلينا بس نترجم.
طبية
تفضل.
صراحة لا نشعر بوقف إطلاق النار بالرغم من توقف يعني إسقاط الصواريخ الثقيلة على قطاع غزة، ولكن للأسف الشديد هناك خروقات بشكل يومي، شهداء بشكل يومي. أيضا أمس دكتور نضال يعني تم الخروج لنداء استغاثة اللي هو سقوط منزل على رؤوس ساكنيه متصدع من الإبادة الجماعية خلال العامين. وكان يسكن في هذا المنزل 3 عائلات، تم نجاة عائلة، ومتبقي كان تحت المنزل 8 أشخاص. تم إخراج 4 على قيد الحياة، واليوم تم استكمال العمل وإخراج 4 شهداء منهم أطفال، نساء، شباب. هذا المنزل هو ليس بالمنزل الأول، هناك عشرات المنازل تم سقوطها على إثر الأمطار والمنخفضات، وهذه المنازل.
Okay, so let me translate while Mr. Faris, comes back. So he's the head of paramedics in North Gaza. Unfortunately, all the hospitals in North Gaza have been destroyed. None of them is functioning now. But the EMS services are trying to try their best to go there and provide for the people. He's sharing that despite what's so-called ceasefire, there are daily attacks on civilians. Maybe the scale of these attacks is not as much as before, but there are daily attacks by airplanes, by quadcopters, by firings, by mortars. They are rescuing people every day. The latest attack was on a family. A whole family was attacked yesterday, and he and his team were able to rescue some of them. Unfortunately, many of them have been lost. There is also the situation of the people living in semi-destroyed homes that are not stable, and they lost their foundations, and many of these houses are collapsing on them. We have seen a few of these incidents in the last few weeks. Unfortunately, whole families have been killed due to the collapse of these buildings on them because they have no other way to stay. They don't have any shelter. They try to use these houses, but because of the wind, because of the winter, they are collapsing on them. And they just rescued one of those families again today. تفضل أبو حمزة.
حياك الله يا دكتور. طبعا يعني هذه كما تحدثنا يعني المأساة لأبناء شعبنا الفلسطيني لم تتوقف. هنا يعني بحب أحكي كمان عن معاناة الناس في قطاع غزة بعد تدمير غالبية المواصلات، صراحة المركبات والباصات، وتدمير البنية التحتية. هناك معاناة دكتور من قبل المواطنين العاديين للذهاب إلى أماكن عملهم، فما بالك المصابين والمرضى. يعني هناك معاناة كبيرة لم تنتهي صراحة، وتحتاج إلى وقت طويل طويل جدا، يعني لسنوات، حتى يتم يعني صراحة انتهاء هذه المعاناة القاسية والشديدة على أبناء شعبنا الفلسطيني، على الإنسان الصحيح قبل المريض. الوضع في غزة صراحة وضع كارثي، ونحتاج كما تحدثت إلى سنوات طويلة حتى نتعافى من ما خلفه الاحتلال الإسرائيلي من تدمير للبنية التحتية والمنازل والمراكز الصحية والمستشفيات وكل نواحي الحياة صراحة. قطاع غزة كان مزدهر في شغلات يعني كبيرة جدا. قطاع غزة كان كباقي العالم يعني صراحة لديه مقومات الحياة، لديه زراعة، لديه مستشفيات رائعة جدا تقدم الخدمات الإنسانية في جميع التخصصات والمجالات. أيضا يعني أصبحت غزة يعني تنافس العالم في يعني إجراء العمليات النوعية في قطاع غزة. الاحتلال الإسرائيلي يعني خلال العامين دمر كل ما تحدثنا عنه من مستشفيات ومراكز صحية. المعاناة يعني تحتاج إلى سنوات طويلة حتى نتعافى يعني كما تحدثت. وهناك يعني نحاول يعني بجهودكم وبجهود كل المخلصين في العالم للتخفيف من معاناة أبناء شعبنا الفلسطيني بعد هذه المعاناة من سنتين من الإبادة الجماعية. نحاول أن نقوم يعني بعمل زيارات للجرحى والمرضى الذين يعني لا يوجد مستشفيات حولهم مثل مناطق شمال قطاع غزة. نحاول إنشاء مراكز صحية. الحمد لله رب العالمين، المركز الصحي الذي تم افتتاحه قبل تقريبا أسبوعين أو 3 أسابيع يستقبل يوميا ما يقارب 400 ل 450 حالة يوميا. يقدم خدمات العلاج الطبيعي والعيادات المتنوعة منها الأطفال والطبيب العام والعيون والجراحة والغيارات. يعني اليوم بس الطاقم التمريض في المركز الصحي شمال قطاع غزة كم حالة غيار توافد على هذا المركز، فبيحكوا لي 70 تقريبا 70 حالة. غالبيتهم يعني كانوا أجهزة بلاتين مركبين ويعني إصابات متنوعة وأمراض متنوعة. صراحة يعني عدد كبير، 70 مريض بالإمكانيات المتواضعة، وأيضا خلينا نقول بالإمكانيات المعدومة في قطاع غزة. الاحتلال الإسرائيلي ولحتى هذه
ابو حمزه
اللحظة
ابو حمزه
يمنع
ابو
إدخال
حمزه
الأدوية والمستلزمات الطبية.
450 مريض
تفضل يا
باليوم
دكتور، تفضل.
450 مريض باليوم ولا التوتال؟
طب التوتال يعني المرضى وتقديم الخدمات من 400 ل 450
كل يوم؟
يعني يتوافد على هذه النقطة يوميا، صحيح،
اوكي
بشكل يومي.
خلينا نترجم هيك. So Abu Hamza said the scale of destruction in Gaza is almost complete. All hospitals or medical points or clinics have been destroyed. The infrastructure have been destroyed. The severe winter weather this season on Gaza is adding more salt to the injury. We're losing a lot of life needlessly, preventive death. This is the indirect toll of genocide on the community, and it's all calculated and engineered by Israel to continue to kill people by other means. Although they do continue their attacks every day, as he mentioned, but many people are dying due to exposure, due to lack of medication, lack of proper treatment, proper housing. Abu Hamza and his team managed to open a small medical point in the north of Gaza, north of Jabalia, in the last 2, 3 weeks. We have been working with them and supporting them with this. But because of the lack of any hospital and any medical point in that area, and because of the huge demand, this point, which is a very basic small medical point, is receiving almost 450 cases every day, whether they are pediatrics or women care or for wound care. They also have a small physical therapy unit that has almost 70 cases that they're taking care of now. They do have their ambulance and EMS services that helps bring the people to the unit. They have been also working with the Ministry of Health. I think the Doctors Without Border also approached them to start providing care with them. It is Abu Hamza team and Doctors Against Genocide who are the main, actors at this point. But يعني it is good news that other organizations are joining forces and trying to offer help and bring more, help to the point. But the problem is Israel is still not allowing any medications or medical supplies or simple things for wound care, gauze, wound changes, topical antibiotics. They're still struggling to get these, but they're trying their best. تفضل أبو حمزة.
يعني كما تحدثت يعني وهنا نؤكد يعني كثير نشدنا صراحة العالم، ونشدنا منظمة الصحة العالمية واليونيسف والصليب الأحمر بالضغط على الاحتلال الإسرائيلي للسماح لإدخال الأدوية والمستلزمات الطبية. هناك ما يقارب 70% من مخازن وزارة الصحة صراحة تم نفاذ هذه العلاجات، وخاصة العلاجات الخاصة بمرضى السرطان ومرضى الكلى، وبشكل عام الأدوية في قطاع غزة شحيحة جدا. وحتى نحصل على هذه الأدوية صراحة بحاجة إلى يعني شرائها من المستودعات الخاصة والخارجية عن وزارة الصحة. الوضع في داخل وزارة الصحة وضع صعب جدا ومأساوي. إذا بتسمح لي دكتور.
خلينا نترجم لك.
تفضل.
So Martha has not
تفضل.
been here for a few weeks because she has been learning Arabic. Can you translate, Martha, what he said, please? You are muted, Martha.
I wish I could.
اشتقنا إليكم. You were talking.
La.
What's that?
Is that no? La?
لا.
What's that?
لا.
La.
ما اشتقتي إلينا يا مارتا؟ لا.
You said you've been away from DAG for almost 2 months now because you're studying Arabic. Okay.
لا. لك.
La.
Okay, Martha. أهلا وسهلا. It's good to see you back. So again, as a Ministry of Health, actually, this morning they issued an emergency alarm and warning, telling the whole world, the World Health Organization, the UNICEF, the international community, they are almost out of all medications, all medical supplies, even critical units like ICUs, operating rooms, basic services. Their stock is at zero. Almost across the board, there's more than 90% shortage of these services. And you're talking about a community that has been undergoing genocide for 2 years. It is the community that has the highest number of amputees, the highest number of, I've never imagined I'll see this amount of people who are having fixators because they cannot do orthopedic surgeries. They are relying on these external fixators to keep the bones aligned, and these are very old style way of fixing things. People here in the West don't use them anymore. Because it's better to do the surgery and fix the wound right away. The only reason they're using them in Gaza because they don't have the capacity to do surgery on all those people. But these fixators are very prone to infections. They are very prone to complications. And if you are living in a tent, if you don't have access to good sanitation, clean water and soap and all these things, this is a recipe for disaster. Most of these people, they don't even have a transportation to go back to the hospital to get wound changes. And even when they go, the hospital does not have the capacity to take care of all of them. That's why we are calling upon the whole world, the international community, the medical community, the American Medical Association, Canadian Medical Association, the British Medical Association. I mean, if you don't want to talk about politics and if you care neutrality and care about life, at least speak about this. It is shameful. It is embarrassing. We are embarrassing that we belong to associations called the American Medical Association. At least speak to allow medications, medical supplies, medical personnel in immediately. This should not be controversial. This is not a political ask. This is not a political stand. You are embarrassing. You are a disgrace to humanity. You are a disgrace to medicine. You are a disgrace. You have always been on the side of the oppressor, the side of the colonizer. You are colonized institutions. You are Zionist institutions. The whole world sees you for who you are now. You are a disgrace to humanity, to medicine, to history, and a day will come when you will be held accountable for all of this. But if there is any spot in your hearts, any humanity left in your hearts, any minimal regard for the profession of medicine and for humanity, at least speak up and demand immediate deployment of mobile homes to save the children, to save the women, to save the elderly, the sick. At least demand the immediate entrance of medications and supplies. The UNRWA, the World Health Program, all major international health organizations are saying, they have been saying for 2 years, we have all the supplies that Gaza need. We have all the medications. We have all the mobile homes. We have all the food. We have everything they need. It's there, sitting on the border for 2 years. We have enough to provide Gaza for 3 months. They don't need your money, the American Medical Association. You can continue to be Zionist. You can continue to be pro-genocidal Israel, but at least allow the medications, allow the food, allow the mobile homes. It is embarrassing. I mean, just for having to say this every day and every week, you should be ashamed of yourselves. You are not the role model of the modern world. You are not the light on the nations. You are not the role model of the free world. You are only genocidal, complicit institutions that are supporting racism, genocide, injustice, and the mass slaughter of children. تفضل ابو حمزه.
يعني يا دكتور، من يعتقد انه الاباده الجماعيه قد انتهت فهو يعني فغير هذا الكلام غير صحيح. انا استغرب يعني صراحه ماذا يريد الاحتلال الاسرائيلي من منع ادخال العلاجات والادويه. نعم، قطاع غزه ممكن يعني يتم دخول عدد كبير من كميات الغذاء والطعام والشراب، وعادت السوبر ماركات لفتح أبوابها، ولكن الاحتلال الإسرائيلي هناك أعداد كبيرة يعني تموت بالبطيء، وهذا يتحمل الاحتلال الإسرائيلي. أستغرب من الاحتلال الإسرائيلي بعدم إدخال هذه الأدوية وهذه المستلزمات الطبية. ماذا يهدف إلى ذلك في عدم إدخال هذه الأدوية والمستلزمات الطبية، وهي يعني صراحة يعني لا تقل عن المواد الغذائية، وممكن تكون في المقدمة عن المواد الغذائية. ولكن كل شيء مهم. الاحتلال الإسرائيلي يتعمد لقتل هؤلاء الأبرياء من المرضى الكلى والسرطان بالبطيء. بشكل يومي هناك حالات وفاة ممكن أن لا يعلن عنها بسبب حالات وفاة طبيعية، ولكن هناك أسباب لهذه حالات الوفاة التي تحدث بشكل يومي في المستشفيات. لو جينا سألنا حالنا سؤال، لماذا هذا العدد من الوفيات وخاصة من مرضى السرطان ومرضى الكلى؟ الجواب بصراحة أنه عدم توفر العلاج في قطاع غزة. هذا هو الأسباب، والاحتلال الإسرائيلي يتحمل المسؤولية الكاملة عن حياة هؤلاء الذين نفقدهم بشكل يومي، وناهيك عن الأطفال الذين يموتون يوما بسبب البرد القارس، بسبب عدم وجود ملجأ لهؤلاء الأطفال إلا الخيمة المهترئة التي لا تحميهم من هذا البرد القارس ومن الفيضانات التي غمرت يعني خيام النازحين في مدينة غزة. الصورة قاسية وصعبة جدا. من يلاحظ ويشاهد من المنظمات الدولية ما يحدث في قطاع غزة يعرف بأن هناك كارثة كبيرة حلت بقطاع غزة بعد عامين من الإبادة الجماعية، وأنا أقول لا زالت مستمرة في منع الاحتلال الإسرائيلي في كثير من المستلزمات الأساسية لأبناء شعبنا الفلسطيني حتى يعيش حياة كريمة بعد هذا يعني القتل الممنهج والتدمير الممنهج من قبل قوات الاحتلال الإسرائيلي لقطاع غزة، وخاصة يعني المنظومة الصحية ومن ثم المنازل والبنية التحتية. يعني هناك شيء صراحة لا أعلم يعني ماذا أتكلم عن هذا الأمر. وكمان دكتور نضال والكلام للجميع، الاحتلال الإسرائيلي لا زال كمان يتعنت بإدخال مركبات الإسعاف ومركبات الدفاع المدني ومركبات المعدات الثقيلة حتى يتم إخراج جثامين الشهداء من تحت الركام. هناك لا ننسى ما يقارب أكثر من 9000 شهيد تحت الركام لا زالوا حتى هذه اللحظة. لا يوجد إمكانيات للعمل على إخراج هؤلاء جثامين الشهداء. صحيح الدفاع المدني بادر وعمل مبادرات لإخراج بعض جثامين الشهداء وهي يعني تحت ركام منازل صغيرة وليس منازل عمارات عالية وكبيرة تحتاج إلى معدات ثقيلة. يعني من هنا نود أن يعني نوصل هذا الصوت من قطاع غزة وهذه المعاناة المستمرة لقطاع غزة. اسمح لي دكتور نضال، إن شاء الله إذا توفقنا نعرض بعض الفيديوهات والمشاهد الصعبة، هي مشاهد شوية قاسية.
Did we lose him? I think we lost him. Iyad, are you with us, Iyad? Iyad? You are muted, Iyad. Iyad, you are muted.
معاك دكتور نضال. السلام عليكم.
Are you
ألف
not
سلام
sharing?
عليك.
Allah khalik. Are you sharing the screen?
Yes.
I'm not sick, Iyad. It's
Yes.
good. So Iyad was doing a parallel presentation while we are on our presentation. He was doing, to save
Yeah.
time,
Yeah.
two parallel presentations. Yalla, go ahead. What are these pictures, Iyad, until Paris comes
Yeah.
back?
First, greetings to you and our colleagues at all. ما شاء الله عليكم. يعني every webinar have a new summary about supporting humanity in Sudan and Congo and Gaza. As a human being, it's very great, and we will not give up. I will add some notes for Abu Hamza speech about some important ongoing casualties, Dr. Nidal, and fatalities caused by an exploded ordnance, UXO, and explosive remnants of war. This is very important. I witnessed a lot of events within the last 3 days. This photo show agriculture destructions and new investigations from international website is interesting in investigation about the genocidal work for Israel and daily trace for what's happened here in Gaza. I will summarize this photo. The destruction of agriculture, land and infrastructure in Gaza is a deliberate act of ecocide and a critical dimension of Israel's genocidal campaign. The targeted farms and greenhouses are fundamentals. If you noted in the plan with the red line and the red color, are fundamental to local food production for a population already under decades-long siege. The effects of this systematic agriculture destruction are exacerbated by other deliberate acts of deprivation of critical resources for Palestinian survival in Gaza. These acts include the well-reported catastrophic and Israeli-made famine, ongoing and continued obstruction of humanitarian aid for Gaza, the destruction of medical infrastructure, as Abu Hamza mentioned, the destruction beyond repair of other areas of civilian infrastructure, including bakeries, schools, mosques, churches, and cultural heritage sites. In total, forensic agriculture has identified more than 2,000 agriculture sites, including farms and greenhouses, which have been destroyed since October 2023, often to be replaced with Israeli military earthworks. And also this destruction, my colleague, has been most intense in the northern part of Gaza, as in the map show, where 90% of greenhouses were destroyed in the early stages of the ground invasion. So it's very important to concentrate about the re-engineering famine they need to strike the siege over the Gaza. So supposedly days ago we entered the second phase of the ceasefire agreement, yet the reality remains ambiguous, irrational, and moving in only one direction: increased suffering and intensified pain. Gaza has been flooded 6 times since the ceasefire. The number of aid trucks allowed to enter has been reduced within the last 72 hours, and the number of commercial trucks also has been blocked or partially entered. Bulldozers have been banned. Until now, the occupation continues to refuse the entry of large quantities of tents, dealing with us only in very small piecemeal amounts. The occupation also continues to categorically refuse, based on field realities, the entry of mobile homes or even the implementation of major repairs to water networks. This is a very serious obstacle. The occupation now controls more than 60% of the Gaza Strip, preventing residents from accessing most eastern areas. By the way, Gaza is extremely narrow, especially in the central areas where its width doesn't exceed 6.5 kilometers. Imagine the occupation is positioned only 3.5 kilometers from where we are speaking now, meaning it's directly adjacent to us. This situation, my colleagues, is neither accidental nor random. The occupation also, I mean, it's deliberately attempting to falsify awareness after facts and entrench new realities. Every day along the so-called yellow line, it's a new equations. Concrete blocks advance, seizing more land. As for what is being promoted about a smart plan for Gaza's reconstruction, there is not a single tangible achievement. The only intelligence applied.
Yeah.
Yeah.
Do you still need the sharing that the
No,
map?
no, no.
Yeah.
Yeah.
If you stop
No.
that, please stop sharing so we
Yeah,
can see.
of course.
We want to hear you.
Yeah. The only intelligence my colleague applied in Gaza has been artificial intelligence used to kill my people, starve them, besiege them, and prevent their medical evacuation. That is the only form of intelligence implemented in Gaza. Therefore, when we talk about a renewed suffering with the onset of winter, the severe cold, and the harsh winter period, we are speaking about accumulated pain and long-term suffering that can't simply be overcome with the passing of seasons. Really, Gaza urgently needs mobile homes. We talk about severe cold here. I will mention example about some statistics from the middle area based on detailed data provided for December 2025. The humanitarian situation in the middle area of Gaza has reached a catastrophic level of overcrowding and resource strain. Below is an analysis of the displacement figures and the resulting crisis conditions. Displacement and shelter analysis we did before 3 days. The data reveals that nearly maybe 300,000 individuals are currently compressed into just 298 shelter units, creating an average density of 1,000 people per shelter. Key geographical insights, I will mention 3 main points. Deir el-Balah, remaining town, the primary hub for displacement, hosting over 51% of total tract population. The density here, 1,027 per shelter, is leading to a total collapse of privacy and hygiene. And also the raids area, while smaller in scale, has the highest individual density with over 1,080 people per unit, indicating extreme pressure on a very limited infrastructure. The bridge area also and the Maghazi camp is serving as a massive secondary corridor, holding over 100,000 people. This likely refers to the areas surrounding the Al-Rashid or Salah ad-Din coastal and central arteries. Also, this area is close to the yellow line and under the shield and explosion and robotic every night. I'm just hearing now also they complete destruction, complete destroying the remaining infrastructure, especially in the eastern part of the Gaza Strip. And also when we talk about the crowded and shrinked area, we talk about impact of environmental and military factors. The humanitarian crisis described in our data is being exacerbated by several external factors reported this month. Weather conditions, as you watched a lot of videos, recent report of storm mid-December have caused heavy rains and flooding, particularly affecting those in high occupancy area like Nusayrat and Zawaida and eastern part of the middle governance, where tents and makeshift structure are the primary forms of shelter. And also the second point, resource depletion, with the average shelter occupancy near 1,000 people, basic services, including water delivery, maybe currently estimated at 40,000 cubic meters for 300,000 people in the region, are insufficient to meet even 10% of the standard daily requirement. And the third point, critical congestion. This status in Deir al-Balah, like a sample, and Maghazi and the bridge implies that there is no more physical space for new arrivals, forcing families to sleep in open streets or on rubble. So when we talk about the catastrophe and preventing AIDS and let the trucks freely enter Gaza, they need to increase the suffering. And also we need high level of awareness of intense pressure to fully reopen the crossing and allow massive unrestricted entry of aid. As Abu Hamza and my colleagues mentioned, we have no time to wait another storm. Maybe within 48 hours or 72 hours, we'll have a new storm. There is also very important note, Dr. Ridal and all colleagues. The occupation killed more than 430 Palestinians during the first phase of the ceasefire. If we calculate the number of days we are supposedly expected to wait for the siege on Gaza to be lifted, 20 points in the so-called peace plan multiplied by 100 days for each item, we arrive at approximately 2,000 days. This means we would have to wait nearly 5 years for the siege under this situation, under this catastrophe and restrictions on Gaza to be lifted. This is a madness and completely unimaginable. Accordingly, we are now facing a new issue raised through press reports. Alleged plans to build a smart city in the city of Rafah. For clarity, Rafah was home to more than 350 people there. This is a local statistics from the Bureau of the Palestinian Authority. People under normal circumstances, it's residents owned land, buildings, farms, and factories. It's a large city by Gaza standards. Today, I don't understand how the mediators or sponsors of the agreement grant themselves the right to take this land from its rightful owners and build housing on it for people who don't own this land and to whom it does not belong, under the pretext of starting reconstruction. Reconstruction in Gaza, from my perspective, from my understanding from previous war, must begin simultaneously in all areas through clear frameworks involving companies, foundations, and international authority a local authority and agreed upon governing bodies. It's unacceptable to facilitate land whose people have been displaced, often repeatedly, more than 10 up to 15 times, under the banner of so-called peace plan. What's being discussed is a process of deception, not a genuine reconstruction effort on the ground. So we will talk again about forcibly immigration with a soft manner without a huge bombardment. Anyone who truly wants to rebuild Gaza must allow full freedom without restriction for civil and humanitarian organizations to carry out their work and fulfill their well-known rules. There must be no restriction on the movement of trucks and bulldozers needed to remove the rubble from the Gaza. It's the reality now. So when we talk about the suffering here, I really I have a mixed feeling from sadness, deprivation, bad maybe impact about the political speech. They need some weeks or many weeks to entering the second phase for the ceasefire agreement. This is a gray region for the transfer from the first phase to the second phase. I expect they will increase the pressure over the civilians and they let them die slowly by the starvation, by the famine, by losing their resources. So when we talk about this catastrophe, they engineering the catastrophe with a new manner without a huge bombardment, as my colleagues mentioned, with a slightly using bombs between time to time and assassination and something like completing demolishing remaining homes in eastern Gaza part. They're preventing the farmers reaching their lands, and there is no one know what's the next days carry for Gaza here. So we need to increase awareness to Nidal, my colleagues, and to talk about the catastrophe we expected from the health perspectives. The infectious environment here, it's very bad, and the sewage also spread everywhere. There is no real solutions to reduce the harms over the especially children and elderly people. So when we talk about catastrophes, it's still ongoing, and genocidal work is still acting over the ground, but they deceive the world by reducing the media pressure over those evils. So we must keep going, keep talking, and the reality will reach all of the world, inshallah. Thank you so much, Dr. Nidar and my colleagues, for your time and for listening.
Thank you, Iyad. Yes, what you shared is very important, and as we all know, we should not be deceived by the Israeli plans. Their plan is to buy more time and continue the genocide by other means. This is public information. This is their explicit intent. They mentioned that even at the beginning of this genocide, that those that we cannot kill through bombing, we are going to kill them through disease, through starvation, through exposure, through deprivation, and using all means necessary to kill as many people from Gaza as possible and make life uninhabitable for those who left, so it will be easier to ethnically cleanse them and get rid of them, at a certain point. So thank you for sharing this information. We need to be aware of this. Keeping the status quo. The status quo is not neutral. There are people dying every minute because of the status quo. There are people dying from exposure, from cold, from starvation, from disease, from lack of medication, lack of housing, lack of infrastructure. Israel violated every agreement they have signed in history, and of course they are violating the ceasefire agreement that supposed to include, after the first 72 hours of the ceasefire, to open all crossing to allow aid in. This is something that Israel continued to violate. Of course, they are violating the ceasefire every day, as Abu Hamza shared. And the hospitals, the people on the ground, The civilians, the healthcare workers are sounding the alarm. We need to be aware. We need to expose, these intentional crimes of deprivation, depriving aid, depriving shelter, depriving mobile homes, medications. Please keep speaking up. We're gonna before I lose Dr. Ahmed Al-Farra. Dr. Ahmed Al-Farra is here. He's been waiting, and seems he has some guests who want to speak with us. So, Dr.
Yes.
Ahmed, I want you to speak now. But
Salam alaikum.
Walaikum salam. How's your connection? Is it good or not?
I have first good evening
Good evening.
for Palestine, but for you, good morning.
I always say good morning Gaza, because Gaza is
دكتور نضال،
always.
انا اخر 3 دقائق معي في البطاريه، بس بدي اسلم على الدكتور احمد لانه زمان ما شفته
حياك الله دكتور إياد.
واشكره. الله يبارك
انت
فيك ويعطيك العافيه.
قديش بعيد عن دكتور احمد اياد؟ How far are you from Dr. Ahmed?
احنا بعيدين 9 كيلو بالضبط عن دكتور احمد.
9 kilometers. When was the last time you managed to go to see Dr. Ahmed or to go to Khan Yunis?
والله احنا يعني بيننا اتصال دائم، بس والله ما رحتش على خان يونس من فترة طويلة.
It's hard,
لأنه
yeah?
كان شغلنا في غزة والشمال الفترة الماضية، هو الكارثة الجوية اللي صارت. بس إن شاء الله له زيارة عندنا، لازم نزوره
الله
يعني،
يبارك
وبضل عليه
الله
القهوة
يبارك
هو.
فيك يا أخوي. الله يحفظك يا رب. شرفنا والله.
الله يبارك فيك. أنا
كلنا
مضطر أغادر دكتور نضال، اعذرني لأنه ما فيش معي
مع
بطارية.
السلامة.
ولا يهمك. Iyad has to leave because
الله
his battery is
إن شاء الله.
running out. But thank you, Iyad. Please
إن شاء
join
الله.
us all the time. We'll stay in touch and keep
إن شاء
working
الله.
to fight this genocide. Dr. Ahmed,
إن شاء
how's
الله.
your connection? Is your connection good?
Yes, my friend. Today I have a very nice surprise.
Yes.
Here, my colleague, Dr. Bang from New Orleans.
Yeah, U.S. Arizona.
Arizona. She's
Hi.
from Arizona.
Hi, doctor. How are you?
She's
Very well.
emergency doctor. She's here to teach us how to use echocardiography for ultrasound, for abdomen, for cardiac, for pleural effusion. She started today with us the first session, and I was a good student.
Yes. Excellent student.
She will talk to the group. She's very happy.
Dr. Ahmed, can I join this class? I know nothing about ultrasound. I would love to be able to learn at least the basics.
Yes.
Come on over.
Hello.
Come.
Yeah, come on. Yes. Okay, I'll come over, please. I want to learn something. Okay, doctor. Please introduce yourself. But before that, we are thankful for you. We are thankful that you made the sacrifice. Took the effort to be able to go to Gaza, and for all what you do. It seems you are with GLIA. So GLIA has been doing great work. And thank you, doctor. Please introduce yourself and tell us what you're doing and how long you've been there and how long are you going to be there, and what did you see so far?
Oh, yes, absolutely. So I'm Bing, ER doctor from the U.S. Here with GLIA. This is my second time in Gaza since the genocide. Last time was last summer, June to July. And so far, I've been in Gaza for about 2.5 months.
Wow.
The first 2 months I spent at Al-Ahli Hospital, or Mustashfa Mamadani in Gaza City. And I think there was a colleague who was talking about how near the yellow line, you can still hear a lot of bombardments and detonations and strikes. And during that time there, although there's a ceasefire, there are times we'd still receive mass casualties, especially in the evening. And we'd still be receiving casualties from people trying to go back to their homes where they're near the yellow line. But I think there were also strikes, even with quadcopters that were occurring west of the yellow line, especially in the north in the beginning. And then in the first week after the ceasefire was announced, we were getting a lot of casualties from the militias, like kind of fighting internal fighting as well. So there's a lot of there's still many challenges. And in terms of resources, I noticed more in Gaza City, but also still in Nasser, that compared to my visit from a year ago, the medical supply situation has not been relieved. There is some relief because there's fewer patient load overall, but in terms of the actual quality of the medical equipment and the quantity of the consumables, there hasn't been much visible improvement. And you have the added on effect of the equipment has been overused for the past 2 years. So there's lots of wear and tear, like the main ultrasound in the ER that we use to diagnose internal bleeding, to find signs of heart attacks, like very critical things. It's kind of on the brink of failure. A lot of the machines, for example, for CT scans, the doctors in the ER are very, very careful to minimize the use of the CT machine because they don't want that to break down. It's the only one that's really available in the public sector in this region. Similar up north, only the one in Mamadani is working for the whole of north of Gaza. So there's just a lot of stress about when these large equipments can come in. And so far that has not really happened. And even in Mamadani Hospital, we'd run out of the gauze, like the stretchy gauze that you would put. It's called we call it the crepe bandages here, the crepe bandages, but like
Crepe bandage.
yeah. So we'd
Like
run out
Keflex?
completely. And we'd have, yeah, similar to Keflex. It's like a little bit stretchy. It's almost like a marriage of the Keflex and the Curlex plus Curlex plus a strap, something like that. Like those types of things where you can actually apply pressure and put a pressure on like a bleeding wound.
The Cuban.
Those are running out completely many times. Even guys, I mean, there's a kid that came in with he had a head injury and needed to be intubated because he was vomiting, and there wasn't even like enough gauze to wipe off the vomit. I had to we cut off his shirt and we used his shirt to wipe off the vomit, and then to intubate there wasn't suction, so you just had to take the vomit out of his mouth with your finger, and then intubate him. Situation's a little bit better at Nasser because I think the MOH has been really good about being really careful about organizing things and hoarding supplies and letting it go out at specific times. But it varies depending on the hospital and the different regions. And in general, there's a great need for more medical supplies that haven't been making it in. So that's been one of my main concerns. And as well as the shelter and the fact that people are still living under very constrained conditions. And I think the other question was how long I'm planning to stay. So right now, I think I can comfortably stay until April, but it might be longer depending on how the situation is. If things are getting worse or if things aren't relieving, it could be longer. I have a pretty flexible schedule at this point. And then Dr. Ahmed's been amazing. It's been great to meet. This is my first time meeting him, and he's so smart and so humble.
دكتور احمد اهلا وسهلا منورنا دائما رافع راسنا وين ما تروح.
يسعدك. انت عارف this is the first time for me to meet my colleague and my friend Beng, Dr. Beng. This is the first time, and we started first session, and she started for me the echocardiography as an example for student. Next week, inshallah, we will start sessions for our doctors training. We will not leave Dr. Bang to leave until she's give us all her experience about echocardiography, inshallah. She's amazing in helping. Our model was Rayyan. You know Rayyan, my son?
Hi, everyone.
Yes.
He's the model that we working on him, on his
They are experiencing on you, Rayyan?
بكلمك نضال.
ريان بدربوا عليك بجربوا عليك؟
شايف؟ They tried to kill me.
He told Dr. Bang that please you have to discover what is the organ that I missed from my abdomen, because I'm eating too much and it is not I'm not obese. There is some part is lost in my body. What is that part?
I'm glad you have food. Rayyan, let them experiment on Muhammad, not on you. Or your sister, the medical school.
لازم والله.
بعدين اختك الدكتوره بلشت medical school. Let them practice on her, not on you. تحكي لهم انا شو اسمه under age and I should not be subject to these treatments now.
الحين هيخلوا جسمي جسم تجارب، بس يلا مش مشكلة. خليني افيد العلم.
So Rayyan is being the subject patient. They are practicing and experimenting on him. How to diagnose problems during using the ultrasound.
Yes, As my colleague Dr. Abeng mentioned, that supplies is nearly diminished in Gaza. But what I want to talk about it in brief about hypothermia, my friends. We lost two kids. The first one is Abul Khair, and the second one is Abdeen. The first one was 13 days old. The second one is 29 days old. The first one was full term. The second one was premature baby, 34 weeks. Both of them were in a tent. Both of them came to the reception room in very critical condition. Both of them came with the core temperature is 30 degrees centigrade. Unfortunately, both of them passed away. We talk with UNICEF, we talk with MSF, we talk with the WHO. Please, we have to solve this problem, because I think we will lose more and more if the weather continue in that cold and that rainy weather or stormy weather. So I think there is a lot of ministers in European countries and a lot of decision makers talking about the mobile home or the caravan to get inside Gaza as soon as possible. But the occupational forces refuse that, and they correlate that with the last one of their dead bodies that is still in Gaza. I think they always looking for something to postpone the agreement that they did about the ceasefire. I think we have to remember that every night we have explosive bombs. You hear the voice this night. Nearly 3 or 4 bombing was done in the eastern area. It looks like a huge bombing. Our colleagues in Deir el-Balah hear the voice, and our colleague in Gaza, south of Gaza, hear the voice. There is a lot of destruction in the eastern area of Khan Yunis. They destroyed everything. They didn't leave any building. They will destroy everything because they want all the Palestinian people to leave from Gaza. I think also we have to mention about the influenza nowadays in Gaza, because there is no vaccine up till now for influenza, for the immune compromised patient, for cystic fibrosis, for DM, for hypertensive, for chronic renal failure. All these patients need influenza vaccine. It's not available. Also, we have to mention that L-Troxine is not available. We have to mention that, the glucometer, a simple method to estimate the blood sugar for the patient is not available. A lot of women is crying. They want to give Novorapid or Actarapid, and they don't know the dose that they will give for insulin, because they don't know the glucose level for their babies. I think the situation is intolerable. A lot of drugs are missed, a lot of medical supplies are missed, but I think we have a decision, or we have a challenge to continue. Next Thursday, we have a celebration for the Palestinian board doctors. It will be, inshallah, in Shifa Hospital. I think Doctors Against Genocide will be in this festival, and they will share. I hope that Dr. Nidar, inshallah, if possible, to make some maybe to talk if it is recorded or direct, or it is, inshallah. The life will continue, and we will not anyway, we will not give up. We have to continue. I think maybe soon, inshallah, if we get in the second part of that ceasefire, it will be better if the borders of Rafah was opened and in the two direction, not in one direction as they want. I think it will be better. That's for
Dr.
this week.
Dr. Ahmed, I have two things from you. Regarding the exposure and the hypothermia, we have Dr. Anar here. She has a basic advice about how to take care of patients of hypothermia, how to use simple tools or simple covers that can protect patients from hypothermia, especially if they made it to the hospital. And also, I wanted to expand more about the influenza outbreak. As we know, I mean, it's a winter season in Gaza, like here for us in the United States, and there is an outbreak of these communicable and viral illnesses. Here in the West, we have the vaccines. The people are well nourished. The people are living in normal conditions. So, it's easily manageable. But considering the situation in Gaza, people are living in overcrowded settings in the tents. They are already malnourished. Their immune system is already lacking. They don't have the vaccines. And especially for, special categories, the high risk for, these illnesses like people with COPD, people with asthma, people with chronic illnesses, the influenza, as simple as, common cold or influenza can take a higher toll on these people. The fact that they don't have access to nebulizers, even simple things, because they have no electricity at home. They have to come to the hospitals. The hospital is already overcrowded. I learned this from your interview yesterday on Al Jazeera, Dr. Ahmed. If you can expand more about a simple outbreak like influenza, which we, here in the West take it as a very easily manageable situation, how much harder is it to take care of this in Gaza, knowing that the outbreak there is worse because of the living conditions? Fadal.
Yes, first, as you mentioned, my brother, that the vaccine is not available. We used to use oseltamivir, Tamiflu, for all the cases that are admitted in the hospital in very serious condition. Unfortunately, this treatment is not available.
So the vaccine
We
is not
have
available, and the medicine for severe
yes,
cases, which is Tamiflu, is not available. Okay.
yes, and the third thing that a lot of cases who have asthma and get in influenza, they have severe bronchospasm and they need a nebulizer by salbutamol to make a bronchodilation for them. Unfortunately, the electricity is not available outside the hospital, so you have to admit all the cases in the hospital that they have bronchial asthma and they get influenza, and this is make a lot of crowdedness in the hospital. Last thing, that sometimes a case of influenza get in complication by super infection. The most famous or the most serious complication for any patient of influenza is a staph infection, mainly MRSA. And you need drugs against MRSA like vancomycin and clindamycin and linezolid. And the three drugs are not available in Gaza. So I think maybe a patient of influenza will live smoothly in Gaza and no one knows about him. No vaccine, no treatment, no diet, no good diet or healthy diet for that. You need aura, you need vitamin C, you need ginger, you need something to initiate his immunity, but you don't have these things. And the last thing that sometimes you need some communication with your people about culture, about influenza, about prevention, about hand washing. You don't have water for hand washing. Maybe you need some instructions about the distance between the infected one and you can't talk about that in a tent that tent contain nearly 10 or 14 people in that tent. So anyone who was infected, he will infect the others. I think we couldn't talk. You know, my friend, the day before, I think since 2 or 3 days, one of our colleagues in the Palestinian port make a lecture about the motor and mental milestones in America and European countries. From Nelson, he was talking about the baby can recognize mother at 6 months, and he can recognize father at 7 months, for example, and he can recognize a stranger at 8 months. He can play with a game at 1 year and a half. He can make a tower or can he ride a tricycle for 3 years at 3 years. I interrupt the lecture. I told them we have to make another lecture for children in Gaza. We can ask at what time the baby will know or listen to the voice of the airplane, and how to differentiate between F-16 and between ايش اسمها الزنانة؟
Quadcopters.
the
Quadcopters.
helicopter
Yeah.
or the drone, the air drone. We will ask the child when the child is able to go and to have water for his family in the tent, to be in the number of people and get from the truck that water for his tent. When the child can go to in the charitable food, to have a turn to take that dish to fill it with the rice or with the lentils or something like that, to get back to his tent. This is our milestone, and this is our motor stones that we have to score in system for the Palestinian people in Gaza. They don't live in humanity or dignity. They live in unbearable and unacceptable situation that everyone should talk about this. Thank you, my friends.
Dr. Ahmed, please stay with us. We have Dr. Anar Sailit. She's a trauma surgeon from California, and she actually made some research and presentation about the management of hypothermia a few weeks back. Considering, or this management was designed to treat the patients here in the U.S. That have all the resources. But unfortunately, we know that the people of Gaza don't have all of these, sophisticated and good quality material that can be used to treat hypothermia. So thanks to Dr. Anar, she managed to come up with some modifications. If there is a way to use simple tools, simple available garments in Gaza to at least help the patients of hypothermia. Dr. Anar, I'll leave it to you to please, present your idea and how we can help using very simple, available covers and sheets with the people of, the people in Gaza who have exposure or suffering hypothermia. Dr. Ahmed, if you please, if you just want to listen to what Dr. Nar shares and see how we can use some of this, to help more people, because the winter just started. Unfortunately, the winter is young. Everything is young now when a whole population is being left at the mercy of the aggressors and naked weather and all these things. Fadal, Dr. Anar.
Thank you. Dr. Afara, so great to see you. I feel like an intern presenting to you.
Thank you, my friend.
But I'm going to go ahead and share some slides really quickly. I'm going to go through this as quickly as possible because I think a lot of it is more theoretical. Can everybody see slides or?
Yes.
Okay, great. So quickly, as Dr. Alfara knows better.
Anar, can you make it presentation style so we can see your full slide?
Yeah, let me see if it's
maybe use slideshow. Yeah.
How's that?
Yes, perfect. Yes.
All right. So unfortunately, hypothermia that is clinically important is more common in children and elderly. Arrhythmias and cardiac arrest are the most severe consequences. Bradycardia is physiologic when patients are very cold, but we worry that they can progress to pathologic arrhythmias. The heart becomes very irritable at cold temperatures, and these arrhythmias may persist even while rewarming is undertaken. Hypothermic cardiac arrest patients should be treated with CPR, basically the way that all cardiac arrest patients are. But it is important to note that fixed and dilated pupils and apparent rigor mortis they do not indicate irreversibility in the same way that they do for patients who have cardiac arrest from something other than hypothermia. It's also really important to recognize that hypothermia causes severe dehydration, as well as renal failure and pulmonary edema when it's very severe. I'm going to send this to Dr. Nidal after this, just in case this is useful, but it just goes over the stages of hypothermia. Cold stress, where basically everything is normal, but then increasing organ failure, particularly affecting the neurologic, cardiovascular, and respiratory symptoms, with cardiovascular being the most acutely dangerous because of the arrhythmias that it causes, and then renal and respiratory failure being more of a concern for patients who survive that. I'm going to talk about passive rewarming. Passive rewarming is indicated for cold stress, so even when you're not really showing symptoms yet, but you've just been exposed to cold and your core temperature is dropping, as well as for all stages of hypothermia. It limits ongoing heat loss and promotes heat retention. So it's basically just doing things that passively use the body's own heat production and preserve that heat production. So examples would be to remove the patient from the cold, remove their wet clothing, and insulate them with blankets and waterproof and reflective coverings. And that's like the main thing that I wanted to talk about today. But if it's available, active rewarming is also an option and is indicated for true hypothermia, where we're placing things like heating pads on the patient's body, taking care to put a sheet or some clothing between the skin and the heating pad because they can cause burns. You'd want to use heated IV fluids or oxygen if those were available, and then provision of any source of radiant heat like a space heater. The rate of rewarming, this typically is not an issue, but about 0.5 degree to up to 2 degrees centigrade per hour, and the goal, of course, being normothermia. The physiology of afterdrop, which is a phenomenon where during rewarming, all of these things are being done to heat the patient up, and yet the patient's core body temperature continues to drop. And the reason for that is when the periphery is heated first, it causes vasodilation of all the peripheral blood vessels, and that cold blood that was in the periphery sort of shunted out of the core now returns to the core and drops the temperature. So the way to avoid that and to avoid worsening the hypothermia is to warm the core before the periphery. Again, any rough handling of a hypothermic patient because of the irritability of the myocardium can cause arrhythmias. So we want to handle them very gently, and hypothermic patients should be kept horizontal and should not truly hypothermic patients. For many of us who have experienced some cold stress ourselves, we want to move around so that we warm up. But for a patient who is truly hypothermic, physical exertion will actually increase the phenomenon of afterdrop and can worsen their hypothermia. And again, I feel so ridiculous saying all of this to Dr. Al-Farra, but just, as basic background. So this is the main thing that I wanted to talk about, which is how to make a hypothermia wrap from easily available materials. I hope that these are easily available. The shortness of supplies is astounding every time I hear about it. But these are some pictures of making a hypothermia wrap. Basically, the most important part of this is a waterproof anything. It can be a tarp, it can be a plastic sheet, it can be a plastic trash bag. Ideally, you'd want to have some insulating material and then a second waterproof material, or if available, a reflective sheet like a foil sheet. These are a commercial product, but you can also use anything that's reflective. And the point of all of this is to preserve that ambient heat. This is a passive heating mechanism. So here in this picture, that is my backyard. That is a tarp, and on top of that is a blanket, and on top of that is a trash bag that I cut in half. And these are pictures of me putting my son in a hypothermia wrap. I've covered up his face because he couldn't stop smiling. So there he is, and we've put some ropes underneath so that we can see.
Can you go back through the layers again? How
Yes.
can we get these layers in Gaza? Since Dr. Ahmed is here,
Yes.
when I use things that they can have access to. So the first layer is what is the first layer, please?
The one you want to put on the ground is going to be your thickest outer layer. So here I have a tarp, but you could use pretty much anything for this. You could use a plastic bag of any sort that is big enough. But I wonder, Dr. Al-Farra, if anything comes to mind.
Dr. Ahmed?
Yes.
So this is the basic design of covering material that can that we can use to protect patients with hypothermia. We want to see what of these things is available in Gaza, so we can try to advise on using the things that you have, not the commercial products that are available here. So the first
I
one,
think it's available. I think it's available, but we have to distribute all these things among the tents. We are talking about 1.5 million people are in the tents. So if you want to solve the problem, you will solve for each tent. You will have this equipment in each tent.
So yeah, Dr. Anar, the first one has to be the thickest layer. Then the
Well,
second one can be
you want to have something that is waterproof. So if you only have one layer, it just needs to be waterproof. Any waterproof material is going to prevent heat loss. It's going to have that passive warming effect.
so something nylon. Anything nylon would be good, even if it like a trash bag or any bag of nylon, you can use it. Okay.
Yeah,
And
anything like that.
second one is gonna be just a blanket, a regular blanket can be okay, yeah.
Blanket or clothing or really just any insulating material.
And the third one, the innermost, is also another waterproof layer.
Another waterproof, yeah, ideally. I mean, the best would be to have a reflective blanket. So there's these commercially available, I have a picture of it at the end, commercially available reflective blankets that are, it's a very thin foil, but I imagine something like that would be really hard to get.
And what's the point of having a waterproof? What's the idea? It keeps
prevents, it seals the heat in, basically the heat that the patient's own body is making.
Okay, go ahead.
And allow the evaporation. And so that's how this whole contraption works, but it can actually be pretty effective.
Yeah, sorry for the interruption. I just want to make sure it's clear.
Oh, no, thank you.
Yes. So 3 layers, 2 of them has to be waterproof.
Yeah, and the rest of the stuff it's really just showing like step by step. You roll the layers around the patient.
This is
like
your
this.
son? This is your son?
That's my son a few years ago.
What's his name? What's his name?
Name is Kaveh.
And did he give you a consent to be
He did.
So you are using your son like Dr. Ahmed Farner using his son to practice for the ultrasound. Okay. Where's Rayan? You're not the only one, Rayan. We have other kids who are being used here.
My son was
He's
just
here. He's here. He's going.
Where's your son?
I can call him. I can get him over here. Show him.
Yeah.
One day, inshallah, they'll meet.
Okay, inshallah.
Okay, so here's the last layer. That's me tying my son into this thing. So this is the other thing that I think is really important. This is the finished product. So this wrap, when we made these pictures, it was for, for EMTs who are rescuing people in the mountains, things like that. So EMTs are monitoring the patient. And so the standard technique that is shown here for tying a patient into these waterproof packaging, basically, assumes that somebody's going to be watching and making sure this doesn't cover their nose and mouth. So for example, a baby or somebody who can't necessarily protect their nose and mouth, you would have to be really careful that this material does not cause suffocation. I sometimes use this on my own kids when it's raining and they forgot their raincoats. I just put a trash bag on them and it looks ridiculous, but it works really well to seal the heating when we're going for a hike or whatever. It's something that can easily be used by anyone, but you would just have to be really careful, for example, if you're using it while you're sleeping in an exposed environment, that anyone who is sleeping who isn't so mobile, for example, a young child or a baby, that they would not, during the night, that the plastic wouldn't obstruct their nose and mouth. So that's the one concern that I have about this entire technique is if people are using it particularly on young children or for injured people, they really do have to be monitored, or you have to otherwise keep that obstructing material away from their nose and mouth. Thoughts from Dr. Al-Farra?
What do you think, Dr. Ahmed? Dr. Ahmed?
Oh, he may be frozen.
Yeah, I think he's frozen. Yeah, but this is very helpful. Thank you, Anar, for sharing this. At least it's basic, and hopefully, we need to share this presentation with our colleagues in Gaza. They can share it with their families, I know maybe we cannot provide for every person in Gaza who's experiencing exposure, but these are basic things that they can use with whatever supplies they have at hand. I think we lost Dr. Ahmed. Yeah, thank you for sharing.
You're
Actually,
very
if you
welcome.
don't mind, we wanna. I think this presentation is so important. I didn't think you're gonna come up with comprehensive presentations. That's why we left it at the end. But if you don't mind, we can share it next week. If you don't mind sharing it next week at the beginning when we have more people watching this and more colleagues from Gaza. It's
Absolutely. I'll
worth
send you the
resharing.
slides.
Yes, please. It's worth resharing again next week, earlier in the webinar where everyone is there. We want as many people to have access to this basic information that they can use to help save as many people as we can. Karama?
Yeah, there are some questions about skin to skin heating, which is, I think I'm sure people do it in the when they're during sleep. It's not nothing is about this is ideal because there are ways to keep shelter, and we're just like scrambling for makeshift solutions. But I think skin to skin heating is definitely, I'm sure people are doing it already with their children, especially small children.
I'm trying to look at the questions if there is anything related to this. Wondering if how skin to skin is recommended for hypothermia. Okay, yeah, that's the question that you shared, Karama. Okay. Okay.
Good.
Mr. Faris, are you there? Abu Hamza?
I think Claude wanted
Claude,
to.
unfortunately, yeah, he left. I'm sorry
He
about
left?
that, Claude. Yeah, he just shared the message that he could not. He has another
Oh,
meeting going on. Maybe the people could not speak today. We'll give them priority next week.
yeah.
I know, sorry, we have always many guests, but it's all important. And despite our webinar lasting 3-4 hours, it seems we're still short on time. We need more time to hear from everyone. So we'll adjust next time. People who did not get a chance to speak today, we'll have them speak earlier on next week. Mr. Afana, Abu Hamza, are you still there? Abu Hamza wants to share some. Ahlan, ahlan. Karama, if you please, Dr. Abu Hamza wants to share some of the videos and pictures for the. I
Does
shared
he
it in
want to
the group.
share or should I share them?
Yeah, sure. Yeah, share with us, please. Some of the
I
work.
share?
Yes, please.
The ones you posted, right?
Yes. He also has connection problems. He cannot. There are more videos he wants to share, but it seems he's
دقيقة.
able to send them, please.
I have to download them.
Okay.
Okay, منيح. Okay, good. This is the wound clinic and primary care clinic. Nidal.
Yes, yes, and also the videos here.
Can you see it?
Yes.
So yeah, it's
So this is the medical point that Abu Hamza and his team
like urgent care.
managed to put in Jabalia. It has a regular clinic for pediatrics, for general care, primary care, wound care, and it seems due to lack of other medical points at that point in that area, they are receiving almost 450 cases every day.
Wow.
All kinds of needs. Oh my God, I cannot imagine these people. And this is the physical therapy. They're having a physical therapy unit also.
Oh, this is
Now, this is some of the work. أبو حمزة تفضل. Do you want بدك تحكي عن هذا الفيديو the rescue missions that you've been doing with your team? سامعنا أبو حمزة؟
تمام.
يا سامعك. تفضل احكي. هاي الفيديو.
سامعك.
Do you see the video? This is your team. تفضل.
هذا دكتور حياك الله. هذا فيديو امس الساعه 10:30 مساء. لم يرى بانهيار منزل في منطقه الشيخ رضوان.
This happened yesterday, yeah?
المنزل مكون من 3 طرق. كان يوجد فيه 3 عائلات. طبعا وصلنا للمكان، كان وجود تحت الأنقاض 8 أشخاص، منهم أطفال ونساء. طبعا أخذ وقت طويل حتى استطعنا إخراج 4 أشخاص على قيد الحياة من عائلة لبد في منطقة الشيخ رضوان، بسبب عدم توفر الإمكانيات لدى طواقم الدفاع المدني. طبعا استغرق عملية الإنقاذ للأحياء ما يقارب 6 ساعات، يعني بدأنا 10:30
So this is a case.
وانتهينا الساعة
خلينا نترجم يا أبو حمزة. This is a case of a rescue mission that they did yesterday. A house collapsed on a family of 8. The family is from a Lubad family. Abu Hamza and his team went there to rescue them, but because of the lack of equipment, it took them almost 6 hours to rescue 4 survivors who were still alive. Unfortunately, the other 4 were found dead. But it just tells you how hard is it to, first of all, have to respond to these things multiple times every day for the last 900 days, and at the same time you have no equipment, you have no material to help rescue these people. This is just a house that collapsed on them because the house was in bad shape and due to the severe weather. تفضل أبو حمزة.
حياك الله دكتور. طبعا كما تحدثنا، المنزل هو سبب ناره هو يعني التصدع بسبب القصف اللي كان على مدى العامين على قطاع غزة. وهذا ليس بالمنزل الأخير، قبله هناك منازل تم سقوطها على رؤوس ساكنيها، منها منزل آل بدران في منطقة بئر الناعجة، وتم استشهاد 5 أشخاص تحت الأنقاض، وإنقاذ طفل واحد فقط على قيد الحياة.
The house before
قبل
that,
قليل أيضا وأتحدث مع
the
قبل
house
قليل
before that, 5 people died and they were only to rescue 1 child.
وتم تم تم تحرك طواقمنا إلى منطقة ملعب فلسطين في وسط مدينة غزة، لكن بحمد الله تم إخلاء السكان بشكل مباشر من هذا المبنى المتصدع من إثر العدوان الإسرائيلي على مدى العامين. الحمد لله لا وجود الإصابات. هذا قبل قليل وأنا معكم على الهواء، يعني بفضل الله لا وجود الإصابات. تم إخلاء السكان من البرج. البرج مكون من 6 طوابق ويحوي أكثر من 10 عائلات، فهؤلاء أصبحوا بلا مأوى الآن.
شو صار في البرج؟ سقط لحاله؟
جزء لا بفضل الله في جزء كان متصدع منه وجزء سليم، فالجزء المتصدع انهار بشكل جزئي وتم إخلاء كل العائلات اللي في البرج، لكن الحمد لله دون وقوع إصابات. يعني أي لحظة ممكن هذا البرج يقع، يعني أي لحظة، لكن الحمد لله أخلينا 10 عائلات، تقريبا 10 عائلات بقت في داخل هذا البرج.
So while Mr. Abu Hamzi was with us on the call today, actually, there was a 6-floor building that unfortunately was partially damaged, and the other intact parts starting to crack, and they managed to evacuate 10 families from that building. Alhamdulillah, they were all safe, but the problem is now they are all homeless and they have no place to go. تفضل.
في عندك بعثت لك يا دكتور على الواتس بعض الصور العمل النقطة الطبية، بتقدر تشاركهم من عندك؟
Yes. المشكلة إنه Karama and Mesa are hijacking the Zoom, and they are the high-tech people. Unfortunately, they are busy. Let me see if I can share.
I'm here.
Oh, you're here, Karama?
Yes. Which
Yeah,
pictures? Which pictures?
The medical point. Some pictures of the medical point, please. The work in the medical point.
The ones that I just shared?
Yeah, can you share them again, please?
Of course, yeah. Come on. 1 second.
Thank you, Karama, for staying. Karama is about to travel too, and this, you know how you get busy when
Hi, this is Dr. Farah's daughter, by the way.
Oh yeah, we'll talk about it he's still here, so we can. Yeah, this is the medical. This is the medical point. Hi, Sura Abu Hamzi.
لا 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 لا
Hi.
Yeah,
هذه
this one. Yes.
الصورة صحيح.
Oh, yeah.
So please support the medical point. Please support Gaza. You can donate to DAG Relief. You can go on the website. Hopefully, we can share the links here with you. But any donation, especially now, at the end of the year, I know everyone is going on, the holiday spirit now and Christmas spirit. I don't think, I think the least we can do for people who are celebrating these holidays, knowing that there are families, there are children who are living through these conditions, whether it's in Palestine, in Gaza, in Sudan, in Congo, the least we can do is to help support these families, try all what we can to help them. It's not ideal, but it's better than nothing. Our colleagues, Mr. Faris and Dr. Ahmed and Iyad and everyone is trying their best, everything they can to help, these families to build simple medical points for them. They need support. They need to buy medication. They need to buy supplies. They need to buy gauze for these families. So please, any donation, end of the year, Christmas, whatever holiday you're celebrating, from the comfort of our houses here and our clinics and our hospitals, we should remember that there are people out there, there are whole population, whole communities that are not able to have the basics, the mere basics of life. And our colleagues here are trying their best to help. So please donate to Doctors Against Genocide. Please donate to our colleagues in Sudan, the Sudanese American Physician Association. Please donate to the Congo campaign, our colleagues Khadija and Elvis. Every donation, everything you can do is going to help children, mothers, families to survive through these miserable conditions. And your donation is going to be tax deductible. So maybe taking some of the tax that will eventually go to buy bombs to Israel, maybe instead of sending it that way, instead of paying your taxes, if you donate now, it is tax deductible, so we can decrease the number or the amount of billions of dollars that are going to fund these genocides everywhere. Please remember and spread the word. Any donation now you make is helping people in need, and it's taking away money from those who are using these billions to buy bombs and to commit war crimes and crimes against humanity and genocides in our name. So put your tax money, hard-earned money, for a good use by donating it to good causes, to humanitarian causes that help the vulnerable, the people who are in need, instead of paying them to the treasury so they can send them through our Congress to Israel and the war perpetrator regimes all over the world to buy more weapons and kill more people. تفضل أخ فارس. Anything else you want to share with us?
Nidal.
تفضلي.
When we started, we also wanted to hear from Iman and Dania about the hill.
Yes.
We were there last week.
Yes.
أخذنا عليهم.
Iman and Dania. Iman and Dania, are you ready? So we were in DC last week. Iman and Dania led the action, talking to our elected officials in DC. And please share with us how did that event go? What is your reflections? What's your message? What else we can do to push, these causes to save more people? تفضلي إيمان.
Assalamu alaikum. Yeah, we had a pretty nice sized group of people who came. I think there were about 30 of us, and we had, I think, 26 meeting scheduled, and I think a couple folks actually got to meet with the actual congressperson. I guess feedback was different from each office, but we felt like I know from the group that I was in, we were getting some helpful feedback, which essentially was that we really need to get Republicans on board, especially when we were talking to the senators, that something bipartisan is probably going to hold more weight. But yet we still pressured these offices. Our main thing that we were trying to push was for the mobile homes. The excuse that we kept hearing, but we just kept reiterating, like the excuse was this Israel saying there's dual use for the mobile homes. And we reminded them that Israel has also said baby formula has dual use. So I think we really find that it's necessary and important for us to be there, to be following up with these offices so that we hold them accountable and they're not buying the rhetoric and the propaganda that is coming out from both the Trump administration and from the Israelis. And so we actually, and I don't know if she's going to do it or not, but we had talked to the National Security Advisor for Senator Reid, who's going to be going to the U.S. Command Center in January, and Nadal pressed her on coming live from there and talking to our group. So we're really trying to form these connections with the offices to see how much they can do. We were telling them to call the Israeli embassy, to use whatever contacts, instead of them like pushing on us, or they'd be like, oh, you need a Republican. We're like, okay, well, what are your friends? You need to reach out to your friends and get back to us. So I think as we're going more frequently, we are developing those relationships, but I highly encourage more people to come with us. I mean, 30 is a great number, but imagine if there was at least 100 or more of us, what that would look like. I mean, we are an obvious eyesore when people see our white coats and with the logo. Mary Beth and Nidal were down in the Senate basement, and there were there were journalists down there interviewing senators because they were voting on something that had to do with Venezuela. It was a prime opportunity. And I mean, if there were 100 of us walking down the hallway, and blocking their view, they can't really move their cameras without seeing us. So, so I think that part's important. I think we're going back on the 14th of January. Dania, I don't know if there's something else you want to add, or anybody else who was there with us, but please take the time out to go with us. We need the support. We need to hold these people accountable, and you'll feel like you've done something, in a time where we feel like nothing we're doing really seems to be helping.
Yeah, before we go to Dania, I want to just emphasize the point that you made. We need more of us. I mean, we go usually 30, 40, 50 of us, but our impact will be much higher if 100 or 200 of us are willing to go. The senators themselves are telling us, if you bring me 200 doctors, 300 doctors, 1,000 doctors, I'll do whatever you want, because I know there is real pressure. There are, people, the constituents really care. This is what is there on their mind. And I know I have the backing to push for, for these policies. If you just the usual, suspects keep showing up, few here, few there, of course, it is important. It does help. We are in their faces. But when more of us come, we can be more impactful, and we can go. Actually, we should be there every day, not just once a month. Now, because of the capacity, because the numbers that we have, we are managing to go there once a month. But if we go there every day, there is always something you can do. There is always a senator, a congressperson here and there that you can talk to. And when you are talking to them on the personal level, even if they don't agree with you 100%, you do leave an impact. At least you remind them that there is, these things going on. And we also, I mean, put us ourselves in their shoes. There are so much going on in the world, so many internal things here, internal things there. So it's very easy for politicians to get distracted by other things and to avoid the most risky subjects for them to speak about when it comes to Israel and stuff like that. That's why our presence is very important, to refocus them on this subject, because this is being done in our money, in our name. with our taxes. So it is very important. Please, we need more of us to be there. And once we have enough numbers, we can go there twice a month. We can go there once a week. At one point, we need the medical community to be so involved that we do have a continuous presence in, these halls of power that are making decisions on our behalf without our consent. تفضلي دانيا.
Hi everyone. Yes, we do need more people to join us. One, and I'd say the overarching theme this time was that there was little to no resistance that our people were met with. Everybody seems to be on board. Everybody understands this is a U.S. brokered ceasefire. Our name is on this as the United States of America. But the daunting feeling was people telling us that they felt limited to what they can do. That tells me that the work that's done in between our monthly visits is not being done. I don't feel that these offices are getting enough calls. We do have a call campaign for the mobile homes. I really, really urge everybody tomorrow at 9 a.m. to start making those calls before these people are dismissed for the holidays. We've been sending out mass emails over the weekend to implore people to do everything they can, use whatever leverage they have. So please, 9 a.m. tomorrow, as soon as those offices open, you just put in your information and that campaign directs you to whatever office you're connected to. Something else that we were encouraged to do, if there's anybody on the call that has connections in Republican states to Christian organizations, they felt that those could be impactful. Also, something else that was suggested was if anybody has any connections to the State Department, please get in contact with us at info@Doctors Against Genocide. That was something else that was suggested, that we meet with the State Department directly. But yes, I can't stress enough, please, next month is a new month, PTO packages roll in, please take the time off. Something that also we struggle with is a lot of offices won't give us a meeting if we don't have a constituent present. Sometimes we are able to get away with it with just little tricks we've learned, along the way, but offices won't meet with us if we don't have, for example, a constituent from Kentucky, a constituent from Alabama. So please jump on a plane, join us. It's like I said, it's empowering. You really feel like you're face to face and you're having these conversations with staffers. You're meeting, senators at the media checkpoint in the basement. It's very important. So please join us for next month. And thank you.
Thank you, Dana. Yes, as Dana mentioned, the call, please. We prepared this call. It's very important that we call these offices, and we use this platform every action. Once you call the call or your message, which is prepared there for you, or you can improvise, you can add whatever you want. It will go to all the elected officials in your area and the federal one. So please, the call only takes a few minutes, but it does make a difference. It might save a life. And also for those who hesitate to go to DC, in the beginning, when we used to go there, we used to shout at them, we used to fight them because we were talking to walls. There was no response, complete denial of everything that's happening. And we don't regret that because at that time, that was the right way to approach this. But we are maturing and also we are making a difference. We are making a difference because now, as Daniel mentioned, people now are more receptive. They are aware. They know what's happening, and we're talking to them in a very respectful way, very professional way. It's really very inspiring, very engaging because the staffers they actually want to hear from us. They are thanking us for coming there. So please don't, Nidal Karama, we're not gonna get you in trouble. You're not gonna be arrested anymore. We are a whole new, new movement now. The staffers, the officers now themselves are asking us, please come, join us, or tell us, update us. We need to hear you. We're inviting them to our webinar. Hopefully, at one point, we will have them come and speak here too, if they are allowed to. And we are doing things in a very rational, a very humanitarian, very respectful and inviting and engaging way. So it's okay. If we made mistakes before, that's fine. We learn from them. But as you said, I mean, when we used to go there was Israeli flag in every other office there. We don't see as many of them now. Most of the staffers are aware of what's happening. They just need some updates, and they have busy schedules, they have other things, they push on them other things to distract them. So for us being there, at least we keep them focused. No, okay, there's still, we need more work here, we need to pay more attention here, we need to focus more here. So it does make a difference. It's risk free. You will meet the best people in the world. You feel like family. The group, the teams that go there, you don't need to be expert, you don't need a politician, you don't need to speak. Just be there, Iman and Dania and Roxana and Maribeth, except Maribeth, maybe she's still risky. But everyone else will make the experience as smooth and as easy as possible, especially for the ones who come for the first time. You will feel it's really very enjoyable experience. And once you make your first or second visit, it becomes natural. Everyone can contribute. It's usually less formal, and just speak from your heart. No one will tell you no, and it actually it makes an impact. And as Dania mentioned, we need constituents and doctors, healthcare workers from every state, from every district in the United States. Because when you talk to any elected official and you tell them, I am from your district, I'm from your state, they start listening more, because now they're talking about their survival, their political position, stuff like that. So it makes a difference. If more of us joins, we can make an impact. And this is the least we can do as healthcare workers who care about life. We want to do the right thing, so we need to help them. They themselves are inviting us to come, and they are very respectful for us. And the updates that we hear from Dr. Al-Farra, from Faris, from Riyadh, from Sudan, from Congo, are very important for them to hear about and get updated every time. For us, we are obsessed with this. We talk about this all the time. We watch the news all the time. We know it, but we cannot expect that that's exactly what they do too. For them, they have other things to worry about. So it is our mission to keep them informed and keep their focus. Maribeth, you looked like you wanted to share something too about this last visit. What happened? What did you do?
Well, I wanted to point out that like that first meeting, maybe I was a little bit sharp, but my group very gently let me know, Tanya and Iman, they're like, "Hey, I don't think we need you to be that aggressive anymore." So okay, I walked it back, and I was gonna say, "Excuse me, Dr. Nadal Jabor, I spoke very nicely to that Republican in the basement."
Yeah. So who was the
No, I have to. I have to say. I have
who was
to
the
say
most
though.
diplomatic person in that meeting?
You were, of course.
See? Of course. So I mean, we can always change course, change track, change strategy.
Right? But like even going back to any organization, the leader should be able to be the nicest person in the group because everyone else is doing the more assertive hustle. So look, Nadal, you got to save the day and be like, "Look, I'm such a nice guy.
I'm
Let
on your
me
team.
let me soothe your feelings."
You're,
Done.
you're giving away our secrets. Very
No, the evolution, honestly, it's like it really should be written about. It's insane.
You mean the evolution in Nadal?
That and just the days on the hill. It's really like something to be written about.
Guys, the ones who are coming are doctors, healthcare workers, professors, master degree. I mean, you are talking about very smart people, very educated people. So we know how to learn from mistakes. We know how to evolve. We know how to carry out a conversation. So every one of us, every one of you, I wouldn't say, I mean, if not smarter, they are more humane than the politicians you are meeting. So don't think that this is hard. Don't think this is a task that is not made for you. Any one of us can make the argument, the points in a very clear, very respectful, and at the same time very firm way. And I mean, once they feel like we are willing to work with them, to help them, to be as a team, we notice that, you know, their feedback actually and their you know, engagement is better, and they are promising to do more. As Iman said, I mean, one of the staffers actually is going to the region early next month. She is going to the Central Command where the American are stationed there. She's gonna share with us her experience, maybe live with the Zoom. If not, we send her all the messages and all the data, what is happening there and what needs to be fixed. So this is important. We want our voice to be heard, and we want the decision makers to act based on facts on the ground, not false propaganda given them to by Israel that, oh, everything is great in Gaza now. They have all the food, they have all the medications, and all these things, which is all false. So we cannot leave these politicians being fed the narrative from the other side, which is all fake, which is all criminal. And thank you for all those who came. Roxana did not manage to join us this month, but inshallah, she will join us next month. Roxana, what do you have? Any reflections on today?
I meant to unmute. Sorry, I stopped the video. Nothing in particular. I appreciated the PowerPoints and I appreciate all the points made. So yeah, hopefully I'll be able to join you guys next month.
Inshallah, inshallah. So we have Dr. Swiyang. She's in UK, so the time is late. I'm going to give her the opportunity, then we'll come back to Hadil, if you don't mind, Hadil. Dr. Swiyang. Karama, do you have to leave? Okay, no.
I made
No,
you.
I'm okay.
I made you host, Nidal.
Okay, I'm host now. Be careful, guys. Put tighten
Okay.
your seat belts.
No. It's just that, you know, I tell you what, for your Hill campaign, can foreigners come along?
Yes, we had actually Dr.
Really?
Yiping. I wish he was with. He's Canadian and he joined us. The good
Okay.
thing, actually, his main reflection. I mean, there are so many bad things about the United States, but there are good things too. The good thing
Yeah.
about the United States is actually they don't check your ID, they don't check your name.
Oh,
Anyone
okay.
can go in. You can go to any office you want. If you do have an appointment, yes, you do, you know, have better reception. You have a time to sit with, talk to them. If you don't have an appointment, you can walk to any office and talk to anyone there. And if they are available, they will talk to you, and they are actually nice about it. So this,
Okay.
we need to
Right.
enjoy the, you know, whatever is left from the freedoms we have here in the United States before they take them away. So even foreigners are welcome to join. They will not check your ID or anything like that, and we are doing it again in a
Okay.
very safe way now that no one is at risk. Even people who have visas, people who have green cards, joined us, and things were fine.
Yeah, okay. Right.
Yeah, it sounds like Dr. Swiyang is planning a trip then.
Yeah,
Yeah, I
yeah,
tell you,
alhamdulillah.
we have got so many people being arrested down here. I've just looked up the figures. 2,500 over the past 6 months. And of these, 31 of them are remanded in custody, which means they're in prison without trial. It is just atrocious, right? And these are just people who are speaking up for Palestine or for injustice and so on. We got situation down here, you see. I need to cheer myself up, so I got to join you, okay? Yeah. See you soon. Face to face, not virtually. All right, Mary Beth, I look forward to meeting you.
Yes, you come stay with me in Philly. We'll have a whole time. I'll take you
Okay.
around.
Okay,
We'll
right.
go up to New York and see Danya. We'll head down to DC, see Aman. Maybe, I don't know if we want to fly all the way out to Michigan, visit with
Sometimes
Dr.
just
out
on
there.
the hill.
But yeah, we'll come, like, let's talk about, like, the next, like, January and February Hill date so you have enough time to plan how to make this happen and how we can support that.
Yeah, but I think we still have to campaign for the hunger strikers.
Yeah.
Yeah.
Yeah, I know. It continues to be more and more dire as we've been following it.
Do you have a chapter in of Amnesty International in USA? Do you?
What's your question, Dr. Sui?
No, because you see, what happened is that we are talking about dehumanization, okay? So For years and years, Palestinians are called terrorists. Now, the friends of Palestinians are also labeled as terrorists. So I've just written to an MP and said, look, even if you think it doesn't make a difference, granting someone a status of prisoners of conscience, asking Amnesty International to adopt them, at least if they die on hunger strike, they die as prisoners of conscience. You cannot just shove them and say they're terrorists, just lock them up in a cell, category A, like this, and let them die. So that's what is driving me nuts at the moment. Yeah.
Thank you, Dr. Suyang. Yes, we need also to speak more about the hunger strikers in Britain, who are really facing some imminent death due to their principled position to stand with justice, with the humanity, and against the genocide. And please, if you live in Europe, in the UK, or even here in the US, we all need to keep their voice up, amplify their voice and their supporters, and keep the pressure on the United Kingdom government to remove these laws that are terrorizing humanity while shielding the real terrorists from accountability. And if we allow it to happen in the UK, then unfortunately the US will use this. They've already been using some of it. They will start using it as it becomes the new norm and the president new standard, stripping us of our constitutional rights, freedom of speech, from our humanity, from our call for justice. So any attack on justice anywhere is an attack on justice everywhere. We need to focus on the UK. Unfortunately, UK has a long-standing history of colonialism, and they have always been leading on, those crimes against humanity for centuries.
Oh, they know how to do it. Yeah.
Yes. So please speak up, talk on behalf of our colleagues, the people of good conscience who are in critical health conditions now and facing imminent death in UK jails and prisons and hospitals because they are being punished for being human beings.
Yeah, because we have to speak up. You see, the Palestinians have impressed upon me for 43 years that we have to be their voice. That's number one. Of course, number two is boycott, divest, sanction. That's obvious. Then humanitarian aid, which DAG is doing very well and MEP is managing. But the last one of this is that we have to support and look after each other. Because we have to, when our people who are doing this, get picked up and suffer, you see. So I think we have to support them in as much as we can, and really, because otherwise the movement just get crushed, you see.
Yep.
Well, and Dr. Ang, if I remember correctly through the news, there were physicians, doctors who were putting themselves outside the prison where these hunger strikers are. Police came, and at least one doctor, the police choked her to the point of loss of consciousness.
Yes.
These doctors who were outside the prison where these hunger strikers are.
Yeah, what happened is that one of them was unconscious, and the prison guards refused to call an ambulance. So one of the doctors who were protesting outside called the ambulance, and he got arrested. And then yesterday, a woman doctor got arrested as well. So it is dire. Maybe what I should do is I can post you whatever I receive. So yeah, I send it to you. Okay. It is really crazy, but we have done it to the Irish, you see. So we are doing it to Palestinian supporters now.
Yep. Hadil, are you there, Hadil?
Good afternoon, everyone. Sorry, I just can't turn my camera on for the moment. But speaking to the experience of going to the Hill, this was my second time, and I do encourage everybody to go. We had medical students that joined us. So as a person whose background is education, education is definitely power and knowledge is power. And so when you give people facts, they definitely cannot deny the truth. They try to. Um, in terms of like medical and what's going on for our students and students in general, in Gaza and Gazan medical students and students in the West Bank and beyond. I want to say that I'm very honored to say that one of my students whose family is in Gaza finally made it. She got accepted into the AUB program in Lebanon. So she's doing emergency medicine.
Yeah.
So
great.
she just took her iPhone 1 exam and she had passed her iPhone 2, which is
Okay.
required. So very, very grateful for that. I spoke to Izzuddin Lulu this morning, and they are working on something as well there to honor the recent medical students who have graduated, as well as welcoming in the new class that will be coming in. So there's a lot of work to be done, connections basically around the world. Students are extremely devastated by the announcement to ban all Palestinians for visas. So I had many people reach out, over 40 people, students, medical graduates who are doing residencies in Ireland, in Qatar, in Doha, all these places, who have gotten fellowships or residency programs in the US, and they're like, what should we do? So if anybody knows of a really good immigration attorney, I'm trying to work with getting an immigration attorney to do a Zoom call with students, so that way they can ask the questions that they need to see, is it even viable to pursue coming to the US in June to start the programs in July. So and all of you, those of you who are MDs, I am not an MD, but for those of you who are MDs, I'm sure you went through this arduous process of going through your USMLE exams and going through the match program. So to get a match and then to potentially be denied it because of being Palestinian is devastating, just completely devastating. So when you reach out to your elected officials, please mention that too, about what it's doing to Palestinians in terms of them continuing their careers and those that are critically ill and wounded not receiving care. I mean, we pay for the bombs, we should pay at minimum for their recoveries.
Yes.
Thank
So,
you.
thank you.
Adil. We need to continue to speak up. Do you see my screen, guys? I'm trying to
Yes,
practice
yes.
my tech. Oh, okay. I managed to do it. So let's share some good news. Let's share some good news. This is from our brother Faris Afani, who just left, unfortunately, because of the connection. This is the medical point that they just established in North Jabalia. He just shared this video. I want to share it with you. So some good news that people, when they are helped, when their voices are heard, when they are getting the means, they are able to rebuild and try to provide for their people. This is the medical point when they opened it, I think, last week.
Wow. Music as well.
The Nancy Dr. Paul Jamal Jafat, who was murdered by the Israeli forces.
وعلى هذه المشاركة لافتتاح هذه النقطة الطبية التي يتم إنشاؤها للمرة الثالثة.
لحظة ولادة حياة جديدة من رحم المعاناة بافتتاح المركز الصحي الميداني شمال قطاع غزة التابع لجمعية الفرسان الفلسطينية للطوارئ، في وقت لا يزال في الشمال يرزح تحت وطأة الدمار والتهجير والمعاناة من غياب المؤسسات الصحية الكبرى التي غيبت قسرا من الاحتلال. في أحلك الظروف وأحلك اللحظات، وقدموا الدعم بلا تردد وفتحوا قلوبهم قبل أيديهم، فكانوا سندا حقيقيا لأهلنا يشهد لهم كل بيت.
وكل مخيم وكل جريح وكل عائلة شهيد.
So thank you. I mean, this medical point in North Jabalia, this is the first time they tried to build this. It was destroyed twice before. The committee, Abu Faris and his colleagues, used to be consisted of 5 people. 3 of those 5 people who started this committee, it's called Al Fursan Committee, were murdered by Israel. So it's only Abu Faris and one of his colleagues left. Abu Faris himself lost his son, 18-year-old son, who was a paramedic. He was killed along with 2 other, colleagues. As you see, they are doing it from basics, tents, or whatever left in Gaza. Nothing sophisticated, nothing, high end, but it's better than nothing. It is already providing for almost 450 people a day. We managed to dig a well there, so they have water access, and the water actually is helping the displaced communities around them. The people of Gaza are very resilient. They're willing to work. They're adamant on their right to survive and to rebuild. Despite all the difficulties, they need your help. Martha left us, but actually I want to announce that Martha, late father-in-law, who passed away last month, and his family are donating almost $100,000 to support the people in Gaza on top of previous donations they had. And they are making these donations mostly for the medical students and for the doctors who are graduating this year. I'm sorry that Martha had to leave, but we are really honored and we are really proud of her. We are really grateful for her and her family contribution. Her children have been also amazing, very supportive of our missions. Her late father-in-law was a doctor himself. He graduated from UPenn, and inshallah next week she will share more details about this initiative. Let me stop sharing. I hope I don't close the. Okay, stop sharing. How to do that? We need to go back to the normal screen. Do you know how to do stop sharing, guys?
Just press the green
Okay,
button.
perfect. Yeah.
Okay.
Okay,
It's
maybe
wonderful.
we can hear from Dr. Ahmed for closing remarks. Dr. Ahmed, are you with us, Dr. Ahmed? So, I mean, despite all these bleak realities that we witness in Palestine, in the West Bank, in Gaza,
أرد عليهم وأقول لهم نعم.
إذا نايم تعبان مش مشكلة، خليه ينام يرتاح. So it is late in Gaza. It's almost
والله الحج انسجم في النوم معكم.
نايم؟
فاتح كان المقابلة وقاعد أسمع بعدين نام في المقابلة.
طيب الله يعطيه العافية. Good night. Dr. Ahmed Al-Farra went to sleep because it is late in Gaza and he's been working all day and it's tired and it's cold there. So say good night to him, please.
Yeah, good night.
And inshallah we'll hear from you and from him more next week. God protect you. God bless you guys. It's holiday spirits. The people in the West or wherever you are enjoying the holidays. Please remember the people who need your support, your help. And as bleak as the situation is, we, the people of good conscience, are making an impact by
Fantastic.
uniting our voices, by raising our voices, by raising awareness about these crimes that are being committed every day, that many people did not even know they exist before.
Yeah.
More and more people are joining us. More and more people are learning the truth. More and more people are refusing to be part of this. More and more people are speaking to their, decision makers. We just need more of this. It is a fight between good and evil. And I maintain that the people of good conscience are the majority, the vast majority. But unfortunately, the money and the resources are being exploited by the very few, and it's being used against all of us. That's why we need to stay strong, stay resilient, and get inspired by the people in Sudan, in Gaza, in Congo who continue to fight despite all these difficulties. And we're making gains everywhere. As we mentioned, when we used to go to the Congress, they used to see us as aliens, as invaders. Now they are actually opening the offices for us. Whether they do exactly what we ask them or not, that's a different thing. I mean, there's still a power, disparity, and we know the lobbies are still controlling a lot of the final decisions, but at least they are willing to listen, and they are asking us, please come, bring us the facts, bring us facts on the grounds so we can fight for you. Give me something so I can, vouch for, which was not the case last year or the year before when we used to go. So it is time now to build on the momentum and the sacrifices that have been made and the good work that has been made, and make it, more impactful, and change the tide. The tide is changing, but only if we continue to fight. As they say, freedom is a constant struggle. Even if you have a prophet now and you put him as the leader of the United States and leave him alone without accountability, they will become enslaved to the power dynamic, to the war machine, to the people of money. So you cannot trust anyone in any leading position, in any decision maker position in the world, if you stop demanding them to continue to do the right thing. Please, we need to keep the pressure up. And it is working, it is slow, it is frustrating, but we cannot give up, because there are so many lives, so many children are dependent on our voice, on our donations, on our action, on our mobilization, on our phone calls. Please call, send emails, send letters. Come to DC January 14th. January 14th. Please take a day off. Take half a day off. You can make a difference. If you are local to DC, please join us. You have no excuse. People who are in other states, consider it just a 1 day of vacation. You can take a 1 day off. We are lucky here in the healthcare in the United States that at least we have the means, financial means, to travel. It's easier on us than maybe the average citizen. And I am sure each and every one of us can take a day off or have a day off. So there is no excuse. There is no risk. Actually, the staffers, the Congress, the people in the hell want to see you this time. This is a huge change. This was not the case. They used to get the police, they used to get the Capitol Police around whenever they see us. They don't do this anymore. They want us to come and talk to them and be nice with them and share the facts with them so they can work with us. I mean, we cannot ask for more. It is on us now. We really need to come, we need to show up, and we can guarantee you everything will be fine. Nothing's going to happen to you.
Well done.
Everything will be okay. If we encounter one maybe incident here and there, we will make sure Dania and Iman get in trouble, and and everyone else will continue to be safe. So
No, everybody will be safe. Inshallah.
yeah, inshallah. Anything else, guys? It is almost 4 o'clock. We have 5 minutes. You want to finish it until 4, or you want to end now? Anar, thank you for the presentation. It was really good. It's very informative. And please, let's hear it again next week or the week after. We still need more people to learn about this.
Yeah. Thank you all so
If you
much.
want to
Thank
expand
you.
more on it, that's great too.
Thank you.
So what's the latest update about the hunger strikers in UK, Dr. Sui? I mean, I know
Two of them are in hospital.
Okay.
Two of them in hospital. Nobody died yet. Two of them in hospital. So the family will take them out of hunger strike because they are not very conscious now, you see. The other 6 are still fighting. So over Christmas, we'll take it in turns to stand outside the prison and make a lot of noise so that they know that we're out there supporting them.
Yep. Thank you. I want to comment also on a comment that was made in the question and answer by someone talking about Jewish people, and also emphasize that we here and people of good conscience are not against any people.
Yeah.
We are
Never.
people of good conscience against people who are committing crimes, regardless of their religion, their nationality, their color, their ethnicity. We are not against people. I think all people of the world are majority good people. I think the perpetrators, the ones who are exploiting all of us, are the minority in every religion, in every nationality, in every country. So please, this is not the space to share anything that can be taken against any group of people, whether
No.
they're Muslim or Jewish or Christian or atheist, or all of the above. Like me, I consider myself, I like to see myself as everyone. And we are not for America first or UK first or Palestine first or Sudan first. We are for humanity first. Humanity for all of us. We need to stop the divisions. We need to stop putting barricades between each other. We all are human beings. We all have feelings. We all have families. We all, respect the life. We all feel the same when we get injured, when we get punished, when we get discriminated against. So, unfortunately, in every religion, there are extremists. In every religion, there are bad doers, but the majority are good doers. There are a lot of people who might be doing or vouching for the wrong things because they are ignorant or because they were fed the facts the wrong way or they were brainwashed. It is up to us. It is our task to educate people, to share the real facts with them, and to try to build bridges. No one can win here if we continue to be divided. The only way we can win is for all of us to unite, to build bridges, to to discuss the misunderstandings and misconceptions, and unite together for our common fight for humanity and for a better world for all of us, for all of our children, wherever they are. So please, this is not the space to share anything that can be taken as hatred. I'm not sure whoever shared this, they meant hatred or not. I did not read the whole comment. But whatever it is, this is not the space for it. We are here as healthcare workers, as doctors, as people who care about life, every life. As a doctor, when you come to me, to my office, or to Dania, or to Dr. Sui, or to Anar, we don't ask what is your religion. We don't ask what is your faith. We don't care what is your color. We don't care if you are a citizen or an immigrant or have a visa or a green card. For us, we're all human beings. Our job, our duty is to take care of everyone the same. This is our job as doctors, this is our profession, this is our moral obligation, and also as a human being. And everyone, if there is anyone who's doing things the wrong way, it is our job to lead by example that no, we are against this. We are for everyone, and we are for justice, we are for equity, for equality, for fairness. We are for making real peace based on justice and accountability everywhere in the world. And I think those who are benefiting from these wars, from these genocides, are intentionally spreading these hate messages to divide us and to make the white people think that your enemy is the immigrants. The one who's taking your salary and your money or making your economy bad is the few poor people who are coming here just to make a living. That is not true. The one who is destroying your economy is Elon Musk and his group, who are making trillions and billions of dollars as we speak, while everyone else is having a hard time making the ends meet. Your enemy is not the black person, is not the white person, is not the Jewish person, is not the Muslim person. Your enemy is those who are benefiting from the system. And for them, the system is working perfectly because the more wars there are, the more money they're making. The more division there are, the more tensions there are, they're making more money. They are profiting from our divisiveness, from our infighting, and from our hatred or misplaced hatred. It is our job here to dispel all these misconceptions and to make or build bridges between everyone. It is 4 o'clock. Anyone else?
No.
I made it to 4 o'clock.
Have a lovely day.
Okay, guys. Thank you, everyone.
Alhamdulillah.
Keep up the good work. Thank you.
Yeah.
Thank you, everyone, for being here. Keep up the fight. Invite more people. Join us.
Okay.
Again, we are all in this together. The people of good conscience. This is our humanity. This is our children. This is our planet. This is the world we want to build and envision and live through. We don't want to live in the world that exists now as we see it, designed for the warmongers and racists and war profiteers. Thank you. We'll
Thank
see
you.
everyone next week. Have a